Thank you for coming. It's Wednesday, April 2nd, and Human Services Committee. There are, we have four bills to go through. I'm going to ask members, because we have a larger conversation. Actually, there's 5 bills to go through, and then there's a larger conversation about the policy omnibus. And I just wanted members, remember we said the other body had asked us to do our due diligence and get as much as we can provided on policy to be able to send to them, because apparently they, had a late start on some things. And so traffic, I think I blamed it on the weather there, Senator Abler. So we did that, and members, you all saw a copy of that, and I know you read it because there are 30 amendments sitting in front of me. I'm glad you're laughing at Keith. I got a dozen that we all looked at because we had asked, make sure everything's in there, what's in there, and what we need to have a discussion on. Let's have that discussion. So I thank you all for doing your homework and bringing that. So I just want to say, as with the bills that we're hearing, if we could have testifiers, please keep your comments to less than 2 minutes each, and that would be helpful for us to be able to get out of here on time, because I cannot afford to pay overtime to my staff anymore, because I don't know, I've got a deficit. Budget cuts. Everybody wants to balance their budget on the backs of Human Services. So with that, Zainab Mohamed, are you in the house yet? If not, we're going to go to Claire. Claire Oumou Verbeten, you had sent a file 666. How did you get that number?
Yeah.
Brandy Earthman, are you in the house? Come on down. I don't see Brandy, so it's all you. Senator, and we're going to lay this one over for possible inclusion in the funding omnibus bill. This is something that this committee, you brought to us, senators, if you remember, was the phone call conversation and the people that are in care and treatment. And so with that, I'm very honored that, Senator Verbeten was the one who really took that charge and did a great job with that. So Senator Oumou Verbeten, your Senate file.
Thank you so much, Mr. Chair. And I was going to start by thanking you for including that in the Human Services Omnibus, and also thanking my co-author, Senator Abler, for his support. But again, this bill is really about eliminating the predatory fees on all forms of communication, including video calls, emails, and electronic messages. In this case, for direct care and treatment facilities, there are this bill came from Judiciary and Public Safety, where the committee I sit on, where there's also the impact to correctional facilities. But I'll focus my conversation for you all on direct care and treatment, and just say that, the prison telecom industry is really a billion-dollar industry dominated by just a few private equity-backed corporations, and they make hundreds of millions each year by exploiting family ties. And for years, we had been complicit in that sort of exploitation by collecting commissions on those revenues. Thankfully, due to previous legislation and then really recently, the FCC's ruling, commissions have gone away, and that's been very important. The personal toll of these fees on our families is just immense, and 1 in 3 families with an incarcerated loved one go into debt just to keep in touch. And so families are ending up facing these really unimaginable choices of either going into debt to stay in contact with a loved one, or forcing their loved ones to spend time, increasingly alone and isolated. And that lack of connection can cause, severe mental, emotional ramifications. It's not just when the person is, in our custody, but also after, and that can really amplify over time and lead to a breakdown of familial bonds. So communication is a lifeline. So many positive ripple effects for families and our communities as a whole. Regular contact with loved ones increases the likelihood of engaging in constructive behaviors, lowers violence, makes the environment safer for our staff and for those who are seeking treatment. And we also know that individuals with mental health conditions often face worsening symptoms due to isolation and limited access to mental health support, and communication services is really essential emotional support, helps, stabilizes people's mental health during treatment. So I think this is absolutely the right thing to do, but it's also effective, more fiscally responsible. The bill does incentivize our agencies to get the lowest rates rather than the highest. And there's the cost-effective strategy as well of really investing in this so that in the long term, we're reducing our costs to have people that are coming back in and out of the system. Fiscal note was completed. I might actually have some questions for the agency because I know that they are a part of the same contract that DOC has, and like I mentioned, this has been, the landscape around this has been changing a lot. And the FCC did come out with capped rates this past summer, and so I know there are savings because the vendors were required to bring down rates on phone calls. And so currently in direct care and treatment facilities, they already do have electronic messaging and video provided, which is great. What you all funded before was the phone calls piece. And I saw the amount that I saw in the fiscal note, I think was the previous amount, but I'm assuming that should have gone down because of the savings and because of the ruling. So I had some questions about that and just what the additional FTE costs.
Do you want to ask that now, or do you want us to? We're going to lay this bill over into the omnibus budget, and we're currently working with the agencies on some questions. I mean, if that's something we want to elevate, it's up to you on this one, because if you clearly have questions and if there's some savings that you might find there's a certain senator on this table that used to say, oh, can I capture those savings?
Well, and I will also say, I'm pretty sure the legislation that we did pass was pretty clear that any savings they have to go towards communication services.
Correct.
So that should go towards covering it, but.
So Carrie, can we get Carrie and Dan, Dan, can you guys follow up with Senator Oumou Verbeten before we have markup, because we're laying this one over, and clearly there's some stuff there. You got a thumbs up from the folks from DCT.
Great.
Make that sooner than later if you could, please. I appreciate that.
Yeah, thank you, Mr. Chair. I just wanted to raise this so the committee's aware. I'm following up on that. I've been doing that on the DOC side where, I spent a lot of time talking to them being on that committee, but we'll also do that with our direct care and treatment
I appreciate your
folks.
work on that. That's awesome. So any members, questions? Senator Abler, then Senator Aaron May Quaid.
Well, thank you, Mr. Chair. Thanks for the bill. I signed on not knowing it would be 666, so it was a pretty good bill up to that point. Just heard you talk about private equity, Mr. Chair, and other members. Yeah. Seriously? So is a rule, any private equity people in the room, raise your hand. You would not want to after what I'm going to say. But is one of the rules of private equity, Mr. Chair, to take money from people who don't have any to enrich yourself? Is that the point? Yeah. So these people private equity is buying up mobile home parks where people have like this nice little trailer. It's the only thing they have, and they charge them $900 a month to rent the dirt it sits on and provide sewer. Yeah. Like, holy cow. And then they talked about nursing homes where they're...
There was a report, Senator. I'm glad you brought that up.
And then, holy cow. So anyway, I forgot this was private equity. And so do the people in these little places, I mean, they're being treated and so on, but do they have a lot of money, Mr. Chair?
I think that the answer to that is probably no.
So we'd rather have them have an equity firm get rich than they just talk to their relatives. And anyway, I'm glad I co-authored it. Thank you.
Wow. Senator.
Yeah, Mr. Chair, thank you so much, Senator Abler. I completely agree. I think in your packets too, you have a letter of support from Worth Rises. They've been doing amazing work on these Connecting Families campaigns across the country, and they're experts on prison telecom industry, have dug into the numbers, and it's really heartbreaking to see not only them making money, but then government previously being complicit in taking commissions and exploiting family ties, and a third of those families going into debt because of it. It just unimaginable choices that they had to make. And I mean, I think again, I'll follow up on the numbers, but like, we're talking about less than 100,000. 72,000 is what is in here for phone services right
Yeah.
now. We did account for lost commission in the previous bill on the DOC side, so we might have to follow up with that here. And then I have some questions about the staff cost, but like the cost for the service is very low.
Yeah, and you know what's, I think, let's go to Senator Aaron McQuaid, because I think this is part of, you know, as Senator Rasmussen and Aaron McQuaid on the whole conversation of DCT, this should also be part of your big pockets conversation. So Senator McQuaid.
Thank you, Mr. Chair. And honestly, I had just wanted to ask Senator Abler if he wanted to comment on private equity. And so it's a great bill. I actually just sent a note asking if I could join it. But Senator Oumou Verbeten, this is the committee that makes Senator Abler question capitalism on a regular basis, particularly private equity. So really glad you were able to bring this here today, because we're just seeing all the places it pops up and ruins everything.
Senator Hudke's just shaking his head down there. I love that. Only in this committee, right, Senator Hudke? Senator, thank you very much. We're going to lay this one over for possible inclusion, and you're going to get together with DCT. I appreciate your hard work on this. I appreciate that. Thank you. So does this committee.
Thank you so much.
Let's go, Senator Mohamed. Where'd she go? Ladies and gentlemen, have you seen Senator Mohamed? You got two bills. Let's get comprehensive substance use. No, let's go family support and consumer support programs, provision modifications, community first services, supports, covered service modifications, certain service under disability waivers, and consumer directed community supports. Authorization direction to the commissioner. That is the longest run-on sentence I've ever read in my entire life. Maren Christensen, you come down. Jelani and Fatima. Hey, Jelani, I haven't seen you in a while. Nice to see you. Ms. Malas, there you go. Let's get another chair out here. Senator, if you could keep it under, we have a lot of work to do too, so if you could please, Maren and team, if you could think about that. Senator, it's all yours. Welcome to your committee.
Thank you, Mr. Chair. And we're going with Senate File 3040 first, yeah?
That's correct. Thank you.
Okay. Thank you, Mr. Chair. Before you is Senate File 3040. On a quiet Sunday in June, the Hopkins community awoke to a devastating news. 4-year-old Awais Ali Mohamed had gone missing from his home. His family, neighbors, and a group of dedicated volunteers searched tirelessly, hoping for a miracle. But by Monday morning, those hopes were shattered. A volunteer found Awais's body 500 yards downstream in Minnehaha Creek. His life, so full of promise, had been tragically cut short. Just a few months later, another heartbreak struck. 11-year-old Mohamed, a nonverbal boy with autism, wandered away from his family's townhouse in Inner Prairie. His mother's worst fears materialized when officers pulled his body from a nearby pond that night. As she stood by the water's edge, she had pleaded with searchers, already sensing what had happened. "I feel my son is in the pond," she said. 2 young boys, 2 preventable deaths, and an entire community left mourning, grappling with the painful reality that these tragedies are not anomalies. These stories are not just about a loss. They are about a systematic failure to protect our most vulnerable children. The statistics are staggering. Children with autism are 160 times more likely to die by drowning than neurotypical peers. Drowning is the leading cause of death for autistic children, many of whom, like Awais and Mohamed, have a tendency to wander or elope. And yet, despite these well-documented risks, too many families lack the resources or support to prevent these tragedies. This is why we're bringing Senate File 3040 today, a common sense bill that allows families receiving home and community-based services such as waivers and grants to use their existing funds for adaptive swimming lessons. This bill does not seek new funding. It simply grants families the flexibility to allocate their resources and toward approving life-saving measures. We know that access to swimming lessons dramatically reduces drowning risks, yet many families, especially those in underrepresented communities, face barriers in accessing them. Organizations like the Somali Parents Autism Network and the Multicultural Autism Action Network have been working tirelessly to provide education and support, but the demand far outpaces the available resources. These families need our help. When a child drowns, a parent's heart shatters into a million pieces, Mr. Chair. It is our responsibility as legislators to look at those pieces and ask ourselves, what can we do to prevent another tragedy? What can we do to protect the hearts of other parents from being broken in the same way? One preventable death is one too many. Senate File 3040 offers a crucial step in safeguarding autistic children by ensuring families can access the tools they need to keep their loved ones safe. Today, we have an opportunity to make a real difference, to turn our heartbreak into action, and to honor the memories of Awais and Mohamed by ensuring that no other family has to endure this. And Mr. Chair, I think we'll get into the fiscal sort of how to navigate that piece, but to my understanding, it should be a zero cost bill. I'll ask our nonpartisan staff, and I appreciate you for giving us a hearing today.
Yeah, no, that there is, I understand that the department has flagged it, that we're having a look at that to see what the cost will just, it'll be, if that's the case, we'll put it in our budget omnibus and have that discussion there too. Do you want to go to the three testifiers, Senator Aki? You want to go? Okay, good. So you got Mr. Hussein. Welcome to the committee. I got Jelani Hussein, Marin Christensen, you're second, and then Fatima Mullis, you're going to be third. Is that there? So, Mr. Hussein, welcome. For the record, please state your name.
Jelani Hussein, Executive Director of CARE Minnesota, Chairman Hoffman and members, and Senator Mohamed. I want to, first of all, thank you for giving us an opportunity to speak on this issue, and I also look forward to the testifying from both Fatima and Marin, as well as also the letters that have been sent by different organizations in support of this bill. As Senator Mohamed mentioned, I also had the unfortunate and difficult time responding to those two lost children. And within less than 30 minutes in both situations, or about an hour, I was there on the scene. And what I did recall was the intuition of those two mothers, that both of them knew that their children was in the water. And this is nothing unique to these families. It is what most autistic families or families who have an autistic child know. According to data, research indicates that children with autism are 160 times more likely to die from drowning. Children with autism are drawn to water. Both Awais and Mohamed lived right next to water, and it was the worst fear of their parents, and it became a reality. Today, this bill in front of you removes provisions, barriers from using funds that are already accessible to these families to be able to get swimming lessons. If we had this bill in play and those children had an opportunity to learn swimming, we would have probably saved these two children and many more. The Somali immigrant community is one of the most disadvantaged economically, 75% poor, with 56% of them being in deep poverty. And that does not even equate to the fact that 1/3 of their income is reported to send back home to loved ones, so that poverty is even much deeper. These resources are a critical lifeline to these families, and having access to swimming is incredibly important. And so we are here today to support that. I want to thank Senator Mohamed for really taking a lead on this, and for the larger coalition that we were able to develop after the death of those two individuals. And I look forward to the support of this and the passing. And I hope also we look at some of the causation and some of the challenges when it comes to autism in Minnesota impacting Somali children. According to the state of Minnesota, and particularly the University of Minnesota, the rate of autism impacting Somali children was at 1 in 16 for 4-year-old. And 1 in 44 for 8-year-olds. Wow. 1 in 44 for the state. So comparing 1 to 16 to 1 to 44. Wow. And also we know that for 8-year-olds was actually much lower, which means it's actually progressively changing. And so obviously that's not the discussion here today, but it is an important, relevant discussion that this community, which is financially disadvantaged, is also facing significant challenges with knowing why their community is subjected to having higher level of autism as part of that. Thank you.
Thank you, Mr. Hussein. Marin.
Thank you so much, Chair Hoffman and Human Service Committee members. My name is Marin Christensen Hofer, and I am a parent of a child with a disability, and I also serve as the Executive Director for the Multicultural Autism Action Network. And our organization is a nonprofit that serves families of children with disabilities in our multicultural communities in here in Minnesota. I'm here to express my strong support for Senate File 3040 and also my sincere thanks to everyone who's worked on this bill. This has been a wonderful collaborative effort that has come out of the heartbreak that was felt by the families of Wais, Mohamed, and Hamid, and we are holding those families in our heart today. As you've heard earlier, the rate of drowning for autistic children is 160 times higher than it is for non-disabled children. We've heard a little bit about why that is, about children being drawn to water or often trying to escape overwhelming sensory experiences. And until about 2023, families in Minnesota were generally able to use some of their home and community-based services funding to cover the cost of swimming lessons. Our organization within the past year or so has been hearing repeatedly from families that are either being denied the ability to use their existing funds for swimming lessons, or they're told that they can only use them to cover the difference between adapted swimming lessons and swimming lessons for typically developing children, which still puts them out of reach for many families. Their requests were often being denied outright on the basis that swimming was considered recreational and therefore not covering. But please make no mistake, for an autistic child, the basics of water safety are far more than just recreation. It is life-saving. Minnesota, we know, is proudly the land of 10,000 lakes, but it's also the land of tens of thousands of water hazards. And every lake, stream, river, holding pond, or drainer ditch is a potential tragedy waiting to happen. Swimming lessons and basic water safety are an essential piece of the layers of protection that we need to help keep our children safe. And allowing families to use their existing budgets, again, we're not asking for additional funds, we're just saying let people use the money that's already been allocated to them, is just a common sense measure. This is what person-centered planning and consumer-directed approaches are all about. We strongly ask for your support of this bill. Again, losing one child to a preventable drowning is one too many, and we ask for your support. Thank you.
Thank you, Maren, and nice to see you again, and thank you for telling us. And the information is, I leaned over to the team saying, why is it still considered recreational? That's the question. Fatima Molas, thank you. Welcome back.
Yes, thank
So
you.
Record, state your name, please.
Thank you, Chair Hoffman and committee members. My name is Fatima Molas. I'm a parent of an autistic child, and I also serve as an advocate for families navigating services for children with disabilities. I'm here today to talk to you about the need for swimming lessons for autistic children. As you are all well aware of, there have been 2 autistic children from the Somali community that died in the past year from drowning. This tragedy has hit our community hard. My phone is constantly ringing, calls from parents of autistic children living in fear of their children eloping and getting into water. For many people in Minnesota, teaching your children to swim is part of the culture. I know many of my friends going to swimming lessons is as much as part of parenting, teaching your child to cross the street. But for our community, this is not a familiar thing. Most adults in our community never learn to swim either. So even if something did happen to a child, there are few adults in our community that will be able to go get them in the water, go after them. We are working to change this to make water safety something every parent thinks about. But autistic children are at especially high risk for drowning. Our autistic children are often drawn to the sensory experience for being in the water, or will run towards water to escape from the overwhelming sensory experience, or simply because they have not yet developed a sense of self-preservation. Autistic children are at especially high risk for drowning, and the fear of a child drowning is something that every parent of an autistic child lives with every day, including myself. I cannot tell you how many phone calls I have received from many parents who are living in fear. In addition to the 2 children we know about, I'm aware at least 5 other children that drowned that occurred in the past 5 years. And countless other near misses where a caregiver was able to get the child before disaster struck. I have taken phone calls from parents who are heartbroken when they learn when they learn that swimming lessons for their children with disabilities were no longer covered, or where the coverage was limited, putting them out of financial reach. This bill allowing waiver or CFSS funds to be used for swimming lessons is not the only solution we need to this problem, but it's an important step in building up layers of protection needed to keep our children safe. We look forward to the day when every child in Minnesota has the opportunity to learn how to swim. But until that time, we respectfully ask you for your support for this bill. One autistic child drowning is one too many. Please help us make sure we are doing everything we can to prevent this from happening again. Thank you.
Thank you. Senator Utke.
Thank you, Mr. Chair. And my questions are only related around the funding question, because I keep hearing the fact that we can use available funds, but I saw a reaction next to me that I think indicated differently. But just even reading the bill, it said upon receipt of approval from the Centers of Medicare and Medicaid Services, I would guess, I take that as they're
Allowable.
working on the waiver. But then I go to the next part of the sentence, and the Commissioner of Human Services shall provide guidance to counties on the administration of the family support program. So as I'm reading that, I want to know who's paying for it. I don't want this as a waiver and even a portion of it being a mandate on the counties. If there is a cost, we need to discuss that here.
Yep.
And not push anything further to them, because we see way too much of that happening.
You must have been listening to the conversation, Senator Utke, that was just happening before this, because it was in the understanding that it would have been fallen into the waiver. We'd have just had some kind of like an exception or something, but then somebody flagged it, which you just brought up, that it could be a cost, and we want to make sure that cost doesn't go to the counties, but rather it comes. That's what I hear you saying, correct?
Mr. Chair, my hearing's not that good, so I didn't overhear you. But yes, we're both on the same wavelength.
Senator Abler.
Well, I didn't even know you were having a conversation, much less overhearing it.
No, I wasn't.
Why
It
would
was-
it-
I heard the corner. She was having
Oh,
a
yeah.
conversation with David, and I don't know. But
That
if
was
you
a
want to get
Hoffman.
DHS down here, we can.
That was a
do
non-funny Hoffman joke.
Well, yeah,
I'm
it was
sorry.
tried. It's okay.
Why does this cost anything?
At least
If
it's
it's an
coming
allowable
down.
use.
Go ahead. Sorry, Jim.
And it seems like the information that they have to pass out, they'll put it in their little bulletin, and they put out bulletins all the time, so.
Can one of you guys make room for?
Only make room if she has good news.
You got good news? So
Oh, Mom.
the question from the committee, I think, and if I get this question wrong, Senator Utke, you can correct me, but my understanding prior to this would have been like some no-cost stuff, involved with this, and I'm just still wondering why it would be considered recreational. I mean, there's lots of whys out there, but can you help us understand that so we can know the disposition of this bill?
Chair Hoffman, members, Elise Bailey, Budget Director of the Department of Human Services. My understanding is we're assessing the fiscal note. We just got it yesterday, and so we're assessing it. But
Okay.
because it's adding an allowable use under, I think, Section 5, we're also assessing the costs, whether Section 3 would have a cost. But we'd have to really do the fiscal note to tell you for sure whether it does have a cost and what the actual value of the cost would be.
Senator Utke?
Thank you, Mr. Chair. And yeah, I can see, because just as I read it, there's a lot of questions here. Number one, there's a cost, but who's paying and how is it flowing through? And so I guess we definitely want an answer to that, and we would have time because you've got a little bit before you do the financial side of the markup.
I think that's I think that was the disposition is to lay it over into our budget bill. So Senator Abler.
Well, thanks, and it may be that there's a part of it's free, like the consumer support grants, you can buy what you want with that, if it's a sensible thing, and if it's an additional waiver service, then that might cost some money, but it'd be nice at least to get somewhere on this.
Yep, going to Senator
And
Mohamed. After
we-
Jim.
We have enough of these kids.
Yeah, no, I
coming
like
to
this
harm.
conversation. Senator Mohamed,
Thank you, Mr. Chair, and maybe Lauren can add some clarification to that as well. I think she's got.
and then go to Elise to follow up on that. So go ahead.
Yeah, thank you,
Mari.
Chair Hoffman. I think they want to be clear, the intention here is that we're not creating a new expense to add on to existing waivers or CSG budgets. We're saying if a family is already receiving that benefit, say they have a $30,000 budget, that they can decide part of that $30,000 I would like to use for swimming lessons.
explains it.
Not to add on and make
Yeah.
it 35.
To your point, that's good. Senator McQuaid on top of that point. No, I think we understand that now.
Thank
Senator
you.
McQuaid.
Thank you, Mr. Chair, and I I'm very interested in the finances insofar as that this bill is free and that families can do this, but I really just want to hit home too that even the most vigilant parent, like I heard a story about a mom who was sleeping in the same bed with her child, and he still got up and he went outside, and she was able to grab him right before he went into a pond. The being drawn to water so fully and so deeply, it's just, you can't sneeze, right, without worrying that your kid has left the house. And so it's just, there is no amount of vigilance or like oversight a person or people could do that prevents this. And I also want to say too, a lot of kids with autism love the water. So in addition to being a life-saving thing, like this is it's a joyful experience, and so it's like a win-win-win because it's also free. I'm gonna, at least Bailey, I think it's free. I think it costs nothing. So this is a great bill, and I hope you'll let me join it, Senator Mohamed.
Do you want to go, anything to add to that?
I
Lily?
mean, Chair Hoffman, Senator McQuaid, of course, our fiscal notes aren't a judgment of whether this should or should not be paid
Agreed.
for and whether it wouldn't benefit the child. It certainly would, and the family. So we're just merely looking at if we added it to the waivers, even within a budget, we forecast based on cash how much we're actually paying. And if it means more the budget is spent, that means that the state would incur costs. So again, we haven't assessed it though yet.
Yep.
So I don't want to say one way or the other, but that's kind of the lens that we look at the fiscal note through.
Thank you. Any final words, Senator Abler, to get our final words from our chair?
Mr. Chair, this is like the military, so they have to like use it up so they can get the next thing next year. And so a family who did not use all their money is now, it's just a budget thing. But so that money goes back into the budget so we can buy tax cuts on roads with it, Mr. Chair.
So
So
you're bringing,
you're being charged
Yep.
for that something less than a part. Anyway, thanks. Just to
no,
make you feel
and
better.
it's that whole underspending, it's that underspending thing that if I don't use it, then it goes to the general fund kind of thing, which we always don't like that. So let's find a way, no, I'm glad you did that. Let's find a way to make this work. I mean, what you've done, Senator Mohamed, by bringing, I have friends that came with stories that exactly, and you gathered people in the community and talked about that. And so thank you for all those conversations and bringing us something that we can see. I absolutely am grateful that you're doing this because,
Senator Hoffman.
Senator Abler.
So if we write the bill that it's something they would have done
Yep.
anyway, but they decided not to do that, even though they wanted to do that and they were going to do that,
Yep.
and it'd be free. There you go.
He just got into a fiscal conversation that only the person to the right of you understood, so, because he lost me on that. So Senator Mohamed, any final thoughts before we lay this over?
Well, thank you, Mr. Chair, for hearing this bill and squeezing us in last minute. I think, the story of Awais and Mohamed are probably the most known stories, but there are hundreds of stories that we don't hear about.
Yeah.
And I think it's an absolute tragedy that hits the community in a really, really deep way, and I think we have the opportunity to do something about it. I know that your budget is tight, but like these folks said, one preventable death is one too many. So I appreciate you.
Great, appreciate you. Thank you. We're going to lay Senate File 3040 over to have deeper discussions on this. Thank you for your work on that. Senator Mohamed, Senate File 3172, the Comprehensive Substance Use and Addiction Plan requirement. Is Mr. Drucker in the house? Anybody see? Oh, Jeremy, how are you? Nice to see you. Hi, John Hoffman. I'm kidding, man. It's like I saw you for like 2 seconds the one time in the hearing. I just thought, I was trying to be funny, but my wife reminds me I'm not funny, so.
It's always a pleasure. Thank you.
It's good to see you. So Senate File 3172, Senator Mohamed, it's yours.
Thank you, Mr. Chair. Senate File 3172 is a proposal to shift responsibility for the interagency state substance use and plan from DHS to the subcabinet on opioids, substance use, and addiction. Substance use and opioid use disorder devastates individuals, families, and every community. Beyond the emotional and social toll, the financial burden is immense. Drug overdose deaths, particularly those involving fentanyl and synthetic opioid, 50 times more potent than heroin, and have fueled a nationwide crisis, claiming over 100,000 American lives just in 2022. 100,000 lives just in 2022. In Minnesota, opioid-related overdose deaths surged 43% from 2020 to 2022, more than doubling more than 2019. While recent years have shown progress, we cannot afford to lose focus. Opioid and substance use continue to harm communities and impact significant public cost. To address this crisis, Minnesota established an interagency sub-cabinet and advisory council in 2022, along with an addiction and recovery director, Jeremy Drucker. This leadership ensures that collaboration across state agencies are coordinated. And so I thank you for allowing us to hear this bill, and thank you to Jeremy Drucker for all the work that he does with this agency.
Mr. Drucker, welcome to the committee. Please state your name for the record and proceed with your testimony.
Thank you, Mr. Chair, committee members. My name is Jeremy Drucker. I'm the director of the Office of Addiction and Recovery. Thank you, Senator Mohamed. I think she outlined pretty well what this bill is. Really what we're doing here is transferring responsibility for an interagency state substance use plan from the Department of Human Services to the subcabinet on opioid substance use and addiction. We've had conversations with our state agency partners, including the Department of Human Services. We feel that the subcabinet is a better venue to develop this interagency state plan. It's why the subcabinet was created. It's aligned with the current duties and responsibilities outlined in statute. And so this is really just an administrative and organizational change. We thought it was important to put it in a statute too, just so it ensure continuity going forward for whoever the next addiction and recovery director is, to have that responsibility for that plan sort of vested in the subcabinet. And I'm happy to stand for any questions. Thank you.
Member discussion. Senator Mohamed, any additional comments before we lay the bill over?
Mr. Chair, I think I also have the A19 amendment. No? I don't have an amendment, Mr. Chair. I thought it was going to go into the bigger omnibus bill, but ignore that.
I don't have an A, Mr. Chair, I don't have an A19. Do you have one?
Oh, okay, Mr. Chair, that's for later when we do the omnibus bill. I apologize.
Okay.
But thank you for hearing this bill, and appreciate you for considering it. And thank you, Jeremy, for all the work that you do with the agency.
And with that, Senate File 3172 is laid over for possible inclusion in the omnibus bill. Up next, we have Senator Hoffman with Senate File 2031. Senator Hoffman.
Thank you, Mr. Chair. Thank you, Mr. Chair and members. And this is Restoration for All is a community-based African-led social multi-service organization that's based in St. Paul. It serves 7 counties in the Twin Cities, and it's supporting those who have migrated to Minnesota with a focus on our African Americans, African immigrants, Afro-Caribbean, Afro-Latinx, and other underserved communities. Dr. Tolulope Ola, she's here, come on up, founder and executive director for Restoration for All. She's a mental health practitioner, African storyteller, an advocate for cultural healing through mind, body, and spirit practice. And I believe you're also an ambassador too, is that correct?
I am.
So suicide, this is where we get into. The suicide is the 11th leading cause of death in the United States. And you look at the latest data, death by suicide was ranked at much higher among people under 34. It was the 2nd leading cause of death in the age groups of 10 to 14 and 25 to 34, and a 3rd for individuals 15 to 24. Population of residents in Minnesota who were born in Africa is about 141,000, according to our recent Institute tabulation on the U.S. Census Bureau. And what's more amazing is it suggests that 26 cases of suicide for the African communities more than average the national suicide rate, which was 14.2 per 100,000 people in 2022. And so what we have here is REFA's dedicated approach to addressing the disparities aligns with the proven model of the culturally responsive care that we've had in the past. And Senate File 2031 will help REFA stay committed to providing those responsive, trauma-informed mental health and suicide prevention services. So with that, we have Victor, I think, is coming down as well. But Victor, are you coming to testify, or is it just Doctor that's going to testify?
Senator Hoffman, I just have Dr. Ola on
Okay.
the list today.
That's good. Then we'll go with Dr. Ola.
Dr. Ola, welcome to the committee. Please state your name for the record and proceed with your testimony.
Thank you so much. My name is Tolulokpe Ola. I'm the founder and executive director of Restoration for All, Inc. It's a nonprofit with a mission to nurture and empower individuals, communities, and organizations by reconnecting them with their cultural heritage. I want to thank you, esteemed committee members, for the opportunity to testify in support of Senate File 2031. I'm here today because our communities are in crisis. Suicide is plaguing the community. Just like Senator Hoffman said, just last year we had 26 deaths by suicide. Those were the ones that were completed, not to talk of those ones that were attempted. And we discovered that cultural stigma, underreporting, and a lack of culturally responsive services continue to put lives at risk. A one-size-fits-all approach to mental health does not meet the unique and layered needs of our population. We want to say that we are already partnering with more than 30 community organizations, youth leaders, faith-based communities, and schools. In 2023 alone, we trained over 400 individuals through youth mental health first aid and suicide prevention workshops. But demand far exceeds our capacity. This funding is also about accountability and sustainability. Our model is data-informed and trauma-informed. We partner with culturally competent providers, we conduct community readiness assessments, and we use local data like the Minnesota Student Survey, which shows that over 40% of African immigrants and refugee students have seriously considered suicide, to design targeted interventions that work. So our youth deserve to thrive, not just to survive. Our elders deserve healing. Our communities deserve culturally responsive care. Senate File 2031 is not just an appropriation, it is an investment in lives, resilience, and equity. Thank you for your leadership and consideration.
Thank you, Dr. Ola. Any member discussion? Senator Hoffman, any additional comments?
No,
Before
thank
we
you.
Lay the bill over?
No, thank you. Yeah, I think so, Mr. Chair, as we have this, we're laying this bill over, and again, it was that there's a missing gap in those mental health services, suicide services, those things that we need to be doing. Gets to our why. So I appreciate you hearing this, Mr. Chair.
And with that, Senate File 2031 is laid over for possible inclusion in the omnibus bill.
Thank you.
Thank you.
Thank you, Ambassador. Second ambassador we've had in front of our committee, you're the second. Did you know that, Ambassador? Doctor, you're the second ambassador to be in front of this committee in our history, so it was nice having you here. Thank you very much.
Thank you so much.
All right, members, we are going to move into, I think that is correct, right, David? We, if you look at Senate File 2443, this is what we had put together based on all of our work in the policy. And I can tell y'all read it because I was only kidding about 30 amendments, but there's good conversation. I think what we'll do is let's get Josh Berg, Nathaniel Olson, and it looks like Terrell Clark and Jill Pooler are on Zoom, and then Sean Burke, that's who I have that wants to come down and talk to us about our policy bill. And I thought we would do that before the amendments. And first of all, before y'all start, I need to move the A5 amendment. All those, you got the A5 in front of you? All those members, A5 agreed, so say aye. Aye.
Mr.
What's that?
Mr. Chair.
Yeah, we can. I mean, if you want to, we can, do you want to do the higher overview on that? We sure can. That's fine. If you want to do that first, we can do that. Yeah, I'm good. I'm good with that. Is that what you guys want? We're going to walk through all right. Okay, Liam, and then we're going to do the A7 on the A5. Go ahead and give us the overview of the A5 amendment. Mr. Monahan, thank you for keeping me on track, gentlemen.
Mr. Chair and members, the A5 amendment contains the chair's policy proposals. I'm going to go section by section. I'm going to just do an overview based on the index that was posted, I believe, on Monday morning. Article 1, Section 1 is from Senator Hoffman's Senate File 3006. This is the first of two related proposals related to spatial separation requirements between residential programs and small assisted living facilities. The proposal requires that for new licensed residential programs, the Commissioner of Human Services must not issue a new license for a program that's within a quarter mile of any existing residential program, nor within a quarter mile of any existing assisted living facility serving 6 or fewer residents. Section 2 is one portion of Senator Mann's Senate File 2522. This prohibits HCBS providers regulated by Chapter 245D from requiring a client to have or acquire a guardian or conservator to receive or continue to receive 245D regulated services. Sections 3 to 9 are from the underlying Senate File 2443. These are DHS proposals related to day services and DT&H rates. Section 10, the chair has a second technical amendment which will actually delete Section 10, so I'll skip that. Sections 11 and 12 are from Senator Abler's 2598. This modifies the required frequency of full assessments for individuals on the disability waivers and provides for abbreviated reassessments. Sections 13 and 15 are DHS proposals related to codifying informed choice training requirements for waiver case managers. Sections 14 and 16 are DHS technical corrections related to the expected implementation of the residential support services criteria. Sections 17 and 18 retroactively delay until 2029 the planned implementation and enforcement of the current law requirements that waiver service providers reimbursed under the DWRS devote specified percentages of MA revenue to direct care staff compensation and exempts from this requirement all MA revenue for services provided in licensed assisted living facilities. And that is from Senator Fate's Senate File 2168. Section 19 is from Senate File 401. This is a Senator Utke bill. This requires DHS to consult with existing groups of interested parties regarding how requests for DWRS rate exceptions are submitted to lead agencies and to the department. And sections 20 and 21 are from Senate File 2750 as introduced. This committee sent a version of this bill to the floor. These sections make technical changes to the nursing facility reimbursement statute. Moving on, Article 2 are policy provisions at the Department of Health. Sections 1 to 4 are MDH policy proposals related to the implementation of a new case mix reimbursement classification system. The next group of sections, which I won't read the list, are modified versions of Senate File 2934. These are a whole group of MDH policy proposals related to assisted living facilities. These sections specify permitted uses of restraints, modify physical plant requirements, clarify requirements pertaining to assisted living directors, delay assisted living title protection, clarify the implications of a provisional license denial, and repeal the Resident Quality of Care and Outcome Improvement Task Force. The next group of sections are modified versions of Senate File 1918, the second engrossment. This was a Senator Dibble bill. These sections modify various requirements for long-term care facilities related to consent to electronic monitoring, retaliation, arbitration, and medication management. These sections also include modifications to conditions under which a healthcare agent may restrict visitation for a person. Sections 12, 27, 29, and 30 are from Senator Mann's Senate File 2522, the first engrossment. It's only 4 sections from that bill. These sections prohibit assisted living facilities and nursing homes from requiring a resident to have or acquire a guardian or conservator to reside in the assisted living facility or nursing home, prohibits an assisted living facility from terminating an assisted living contract on the basis of the source of funding for the payment of housing or services. Sections 13 to 16 and Section 41 are a modified version of MDH proposals, clarifying the type of ownership and frequency of regulatory activities related to supplemental nursing services agencies. Section 25 is a modified version of Senate File 3004. This is a Senator Hoffman proposal. It's the counterpart to an earlier one I mentioned. It imposes a quarter-mile spatial separation requirement between newly licensed assisted living facilities and both an existing residential program serving 6 or fewer people and an existing assisted living facility serving 6 or fewer residents. And finally, in Article 2, Section 32 is Senator Rasmussen's Senate File 2537 as amended. This clarifies the responsibility of registered nurses for comprehensive assessments of assisted living residents and clarifies the ability of licensed practical nurses to participate in the preparation of the assessments. Article 3 is the technical cleanup and policy proposals from the soon-to-be independent agency Direct Care and Treatment. This is mostly unchanged, except that nonpartisan staff modified the way in which the 48-hour rule is drafted. And it includes one new section that was based on TA from Direct Care and Treatment and I believe MMB. Otherwise, it's unchanged from what was heard in this committee whenever that was. Article 4 is substance use disorder service policy changes. Sections 1 and 2 are from Senate File 2647 as amended. This permits qualified individuals other than alcohol and drug counselors to administer comprehensive assessments of substance use disorders and modifies the qualifications of individuals providing SUD treatment coordination. And sections 3 to 5 are also from a Senator Abler bill. In this case, select sections from Senate File 1966. These sections require recovery community organizations to plan for and comply with the record retention and record transfer requirements that apply to all license holders under 245A when the license holder closes or ceases operation. I'll just mention, nothing in this is licensing RCOs. It's just picking up a requirement that applies to licensees and saying RCOs need to look to that requirement and abide by it. These sections also modify the 10-day timeline to provide certain mental health diagnostic screenings to individuals with co-occurring mental health issues and substance use disorders by excluding from the calculation of 10 days, weekends, and holidays. And finally, clarifies the county of financial responsibility for withdrawal management services. And finally, Article 5 contains one section from Senate File 1966. This allows a healthcare provider an additional 6 months to submit its charges to a health plan or third-party administrator if the health plan or the third-party administrator has made an adjustment or tried to recoup payment on a previously submitted claim.
That is what we all worked on this committee this year. Senator Abler? No, we're good. So all those in favor of the A5 amendment, say aye. Aye. Opposed, same sign. Does pass. Members, in front of you then is the A7, which is all that work that Mr. Monahan just did. There are some technical changes to that. Huh? You gonna hand that out? Oh, they're not. All right, I'm passing on. We're piles. We'll slowly do this. So the A7 is being handed out in front of you right now. Maybe, thank you. Thank you. You can have that one. Should we cross-talk these? So we put everything together in the A5, which we all accepted, and then Mr. Monahan, then did his due diligence and showed us the technical changes that need to be done in order for it to fit together. So any questions on what you see in front of you, members? Other than Grunhagen wants us to go line by line on it. So Senator Abler.
We're deleting section 10.
Yes.
It seemed like that was kind of a nice thing to have. Why do we not want people to work for more than one agency?
Mr. Monahan.
It's
Mr. Chair, Senator Abler, we received word after it was put into the A5 that it potentially had a cost. And so we're removing it, and perhaps it'll come back.
Thanks. So, Mr. Chair, is it the cost because if there's not enough people to work somewhere, then the people that
Yeah.
need the treatment and
Yeah.
services won't get them. And this will help more people get the services that you're paying for in your budget.
I couldn't,
Or-
you can't make this up, Jim. I mean, it's like one of those,
Thank you.
this makes common sense to it, and we were looking at it, it felt, but then when you get,
And we have too many workers, so we wouldn't want them.
wouldn't want that, the
doubling up anywhere.
53,000 job openings that are there.
Thank
Senator Westrom, really, I
Thank you,
mean,
Mr. Monahan.
I mean, it was a great thing, and Mr. Monahan did his due diligence, so I appreciate that, and.
So just, could Ms. Bad News Bailey work on finding a way to help us get more flexibility? Sorry, Ms. Bailey. Thanks. Maybe she can fix this. Thank you.
She can fix this. You're going to vote for the amendment, she'll fix it for us. All those, all right, we're good. Did we already pass the A7 then? All those in favor say aye. Aye. Opposed, same sign. So thank you. Now, members, let's go to the A8 amendment, which is an updated SUD language to match the other body. You remember we talked early on, and I think if anybody could pass out the A8 amendment, and that would be, thank you. Questions? We're matching the other body, that's a first. All those in favor of the A8 signify by saying aye. Aye, opposed, oh, go ahead.
Mr. Chair, just a question. Who's moving the A8?
You go ahead and move it. You want to move it?
Okay. Yeah, Mr. Chair, I'll move the A8.
Senator
Mr. Chair.
Rasmussen moves the A8 amendment.
So Senator Rasmussen, to your amendment, does this resolve this nurse definition thing? Is everybody happy now? Thank you.
I answered that for you, Mr. Senator Rasmussen. All those in favor say aye. Aye. Opposed, same sign. Thank you. See, Glenn, I told you this committee up's different than anyone you've ever been in. Am I right on that? Yes. I'm starting to convince you. All right. Those gets us to the technical piece of the bill. David now points to me that says, all right, that's good. We're good. Josh Berg, Nathaniel Olson, Terrell Clark, Jill Pooler, and Sean Burke. Who wants to go first between you two on the table? Mr. Berg, welcome.
Thank you, Mr. Chair and members. For the record, my name is Josh Berg, and as a quick reminder, I am a leader at a nonprofit of affordable, accessible housing, an ARM board member, and a city council member for the great and growing city of Elko Newmarket. For the past 10 years, an active member of the League of Minnesota Cities, and a Metro Cities board member since 2021. Today, I would like to briefly touch on a few pretty awesome provisions within the DE language, both, I guess, with the A7 in there as well, and highlight a couple provisions that need further discussion or simply need to be deleted. First, I cannot express enough how pleased I am to see Article 1, Section 12, amending the frequency of the full min choices assessments included. Article 1, Sections 17 and 18, delaying the compensation thresholds to address the glaring issues with the current cost reporting process. Article 2, Section 7, requiring hospitals to document in discharge plans any restraints implemented and share this information with post-acute providers. Article 2, Section 32, which allows RNs to delegate certain tasks to qualified staff and enables LPNs to work within the full scope of their license. And now I'd just like to draw your attention to two critical provisions that I think need further attention. Article 1, Sections 14 and 16 relate to the residential support services criteria. I testified on this a couple weeks ago, I believe. And this provision, like the compensation thresholds issue being delayed, as I mentioned above, and based on a similar rationale, and was also not heard in this committee or in any other Senate committee before being quietly inserted into the final conference committee language in 2021. This lack of transparency and feedback is extremely concerning, And it did not make sense in 2021, and it makes even less sense now. I implore you to delay this language to properly understand, prepare for, and implement a more effective version if one exists. And then the second provision is Article 1, Section 1, and Article 2, Section 25, so I guess it's 2, but it's around the expansion of the quarter-mile rule. In my humble opinion, these provisions are the worst ideas in the entire bill. No offense intended, of course, to the authors or the supporters. As a local elected official and disability services provider, I have a unique perspective on this issue. Minnesota statute sections 245A, .11, subdivision 4, as currently written, violates the Fair Housing Act and the Americans with Disabilities Act. Courts have consistently found that proximity and zoning restrictions, like the quarter-mile rule, on group homes and assisted living settings disproportionately impact individuals with disabilities. My honest, educated, and passionately biased advice is to actually take this opportunity to strike subdivision 4 out entirely, rather than expanding it with the A5 amendment. You took some steps and deleted 4 lines of it in the A7 amendment, so it was a step in the right direction. There's only 5 lines left. As mentioned, this section is discriminatory, violates fair housing and the ADA, and would almost certainly lose in court if challenged, which is why legal counsel for first-class cities here in Minnesota have advised them not to leverage this law. I understand that supporters of the language will cite a 1991 Eighth Circuit case that involves a dispute in St. Paul, but I would point you to the email that I sent last night about many other cases, especially in any other circuit than the Eighth, and would be happy to share even more that have occurred more recently than 34 years ago that have flipped the precedents on its head. I am no Mr. Monahan, but Mr. Chair and members, this is one of my why issues. For the past decade, I have worked to remove NIMBY-driven policies that prevent Minnesotans with disabilities from living in their chosen communities. Unfortunately, cities and communities continue to try to use local control tools to promote ageism, ableism, NIMBYism, and discrimination. Whether we at the local level like it or not, we need the state to drive this oversight. You have the opportunity to, at a minimum, not make things worse, but if so inclined, and what I would encourage you to consider is to make things right by striking this section of statutes, and let's start solving the real problems that cities, local governments, and providers agree are the real issues. Thank you, Mr. Chair and members, for the passionate discussions over the past 79 days since the session began. Your dedication and hard work are deeply appreciated, and I am grateful for the efforts you will continue to make in the days ahead. I look forward to collaborating with you, the departments, the other body, and the governor's office as we navigate the challenging decisions that come before us. Together, we have the opportunity to embrace new approaches and meaningful change starting right at this very moment. Thanks again, and happy to clarify anything.
Stay there. Senator Rasmussen.
Thank you, Mr. Chair. I had a question, I think, for Mr. Monahan, maybe.
Well, he's talking to Jim right now.
Mr. Monahan, I have a question for you when you get a chance.
I was distracted.
Mr. Monahan, so I think what Mr. Berg is talking about is some of the, and I'm also looking at a letter from ARM here that talks about Article 1, Section 1 of the bill imposing proximity limitations on the location of future community residential settings, and then Article 2, Section 25, imposing proximity limits on small assisted living homes. And as Mr. Chair, my question for Mr. Monahan is, do you know what bills those came from, or what?
Yes, I can answer that.
Mr. Chair?
Yeah, no, I can do that. I can answer that. There's 2 bills, and you want to get, I should get, what's his name to come up here, because there's a group of lawyers that were talking about some of the conversation when Senator Abler, remember when we created 144G, it would have made sense. Some of the provisions of 245D should have gone over there, and this is one of them where the conversation. There's a House bill and a Senate file. The House, it was laid over in the House, and I brought the language in here for us to have a discussion specifically on that. And it's great information is what Josh Berg has done. The League of Minnesota Cities actually wanted a stronger bill that is not just looked at the distance, because right now in 245D, it's 1,320 feet between provider residencies. And then what cities have been saying is that people are, in Senator Rasmussen, they're grouping homes, they're buying homes in a grouped area, and then it becomes almost like a segregated setting with homes. That was their argument. That was their argument, right? And so the question is out there, should it have been consistent with, the question is, should it have been consistent with 245D language to 1320? So that's why that language was put in there for us to have that discussion. Does that make sense?
Thank you, Mr. Chair. Yeah, I'm just concerned with, the letter here from ARM and the testimony that, ultimately this could, be used by cities to limit individuals with disabilities from being able to get the care and services they need. So I'm just concerned about that. But I guess, Mr. Berg, is that the crux of this? Is that this is cities basically saying that they don't want, too many group homes, and I'm saying that in air quotes, in their communities?
Thank you, Mr. Chair and Senator. Yes, that's the basis of this issue. And when we brought this language forward last year, that was part of the testimony. We went through state and local gov. We did answered all of those questions. Now, to be fair, this is not all cities, but I guess through my research and what I've done, I've reviewed over 300 plus city ordinances, and we're all over the place from a local government standpoint. We don't know what we're talking about in this area, and that's part of the challenge. So,
Thank you, Mr. Berg. Senator Rasmussen.
It's Senator Mayquid.
Senator Mayquid.
Thank you, Mr. Chair. So I would, I remember seeing this language before, and I didn't like it, and I don't like it still, and so I'm just wondering if I can make an oral amendment to strike this language as it appears throughout the bill. It would be Article 1, Section 1, Article 2, Section 25. I think those are the two places. And I guess I would look to maybe you, Mr. Chair, or to Mr. Berg, if restoring the stricken language would be important there as well, to not make the statute then. Oh, that's automatic.
It's
Never mind.
automatic, yeah.
Great,
It just,
yes.
it automatically goes. I think, if you want to hear from the league, I see somebody from the league up there. If they want to come and defend this, I'd be more than happy to get those in front of. If not, you guys, I hear you. I'm glad the conversation is there, and
Okay.
So-
Yeah, do you want to do the league? Yeah. All right, Mr. Chair, yeah, I'd love to have the league come down.
oh, we got a guy from the league. Why don't you come on down? You want to make room, Nathaniel, or you guys going to make him in the, that's fine.
Oh, no, Daniel.
If you would, please, introduce yourself. Please introduce yourself, because when I ran into you a couple months ago, you had asked, when we were going to have a conversation on this, and so guess what? Welcome. Here's your conversation. So you want to introduce yourself to our committee and where you're from?
Mr. Chair, members of the committee, for the record, my name is Daniel Life with the League of Minnesota Cities. The league represents the collective interests of the 800.
Can you, what's your last name? Because I have my staff, I can't write that fast.
Lightfoot, like Gordon.
Lightfoot, Daniel
Yep.
Lightfoot. Thank
Yes,
you.
sir. Yeah,
Are you a
just like Uncle
musician, too?
Gordy. That's right.
Can you play that song?
Not as well as he could.
All right, thank you for that. I appreciate it.
Thank you, Mr. Chair and members. So for the record, the spacing requirement piece that you see in this bill is not was not league language. The language that we worked on was the rental licensing piece of this conversation, which Senator Hoffman is aware of as well. As this committee might recall, last session, the legislature passed law that prohibited a city from imposing rental licensing regulations on certain group assisted living facilities. Cities did so prior to the law change to ensure life safety requirements and do inspections on those properties. It was argued by advocates that because the agencies do those inspections annually, that it was duplicative and not needed. We would argue that it is. However, that's not the language before you. The language before you would expand spacing requirements in existing statute to not just apply to cities of the first class. Currently, the commissioner in granting licenses for certain group assisted living facilities has authority to not issue licenses for certain group assisted living facilities if they are within, I believe, 1,320 feet of each other, but only in cities of the first class. This would expand that authority to any other cities in the state of Minnesota. And that's what I can tell you about that language before you.
Senator?
Thank you, Mr. Chair. I mean, Cool. I would like to just strike the language. I would make that motion, that oral amendment.
The motion's in front of us. Senator, let's see, Mr. Monahan, will you have an understanding of what that would be? And then Senator Abler, going to Senator Mohamed, and then Senator Abler after, and Rasmussen. You guys want to go first, or you want to let him do this, and then we let him go first? Mr. Monahan.
Mr. Chair, members, Senator McQuaid stated the motion correctly. Her motion would be page 1, strike section 1. I'm sorry, delete section 1. And page 38, delete section 25.
Okay. Thank you. Before I read the motion, do you want to speak? You-
Mr.
you-
Chair, I'll let my colleagues speak to it.
I'm going Mohamed, Utke, Rasmussen, Abler. Senator Mohamed.
Oh, I mean, Mr. Chair, sorry, I was gonna just say that, I think the league, when they came up, they talked about the rental license piece, which is their bill, and I don't know who's carrying that on the Senate side. That's a bill that I'm glad that is not here, because I think you've done a good work in the past, making sure that the cities do not take away people's rental license.
And to that point, it was laid over in the House. It was a full language. The missing pieces of this bill was that language that was in there. 1320 was brought in for this discussion. If I would have brought the whole thing, then it would have been a longer discussion, but I'm glad we had this discussion. Now we know where this committee absolutely cares about people with disabilities, and I appreciate that. Senator Utke.
Thank you, Mr. Chair. I don't have much more to add because I'm happy with the 2 deletions because I had concerns with that. But now that they're gone, concern is gone.
Senator Rasmussen.
Thank you, Mr. Chair. I appreciate the amendment and look forward to voting for it.
Senator Abler.
Mr. Chair, it's just a love fest. I think that under the current settings rule, currently they cannot be contiguous. There has to be a vacant lot in between or something. Is that right?
That's not my current understanding, Senator.
Mr. Monahan probably
Mr.
knows.
Monahan,
But I
do you
thought
know if
somebody
that's
couldn't
true?
be side by side or something.
We should get, I see somebody from the
I
Department
don't want
of
to
Health
spend all
back
day.
there. You want to get?
Just the easy question, but
Yeah.
the top of his head is good enough for me.
Mr. Chair, Senator Abler, the HCBS setting rule does have language in it about proximity of settings. What I can't recall is whether or not the proximity is related to common administration of those sites, or whether it applies to any sites.
Senator.
All right. Well, it's fine. I don't want to solve it. I think I'm a co-author with you on this, and I think it's a good discussion. And in terms of making things fair, it's worthy of discussion. I don't think the language that you and I had is ready for prime time. I just support the motion, so we'll talk about it some more. Thank you.
No, I think that, and that's the question that still arises, and maybe Lisa Timian and those in the future can look at the 144G versus 245D. Senator Abler, is a discussion we had, I don't know, 6, 7 years ago. This was one of them that was sitting out there, and it would be, but I appreciate Josh Berg, who actually is a city council member. Nobody else? Abler, you're the last one. So Senator McQuaid renews her motion to page 1, delete section 1, page 38, delete section 25. All those in favor say aye. Aye. Opposed, same sign. Motion is done. Mr. Berg, anything else you want to tell us about
Well, since you opened the door, thank you, Mr. Chair. The only thing I would say is now you didn't delete those first two lines, so the suggestion would be to incorporate that into future consideration, because I don't believe the departments are doing that anyway. And perhaps it was deleted because there was a cost, and maybe that's why it was considered for the amendment in the A7. But the considering of land use and all of that stuff, I can make a reasonable guess that MDH is not doing that when processing assisted living licenses, and whether or not it's happening for 245A and 245D licenses is a question for the other department, so.
Wow, it's still a lot, right? I mean, you look at that, it's a lot of work we got in front of us. I appreciate your advocacy. All right, so that settles that. Thank you for your testimony. Nathaniel Olson, welcome to the committee. You want to state your name and where are you from?
Nathaniel M. Olson, a disability advocate for the state of Minnesota. Minnesota.
Good. Thank you. Good to see you.
Somebody has to explain to me this bill, the limitations in where guardianship of the mental disability, like myself, that was under state guardian, we're limitation to that, correct? In the bill, that is Minnesota statutes, section 54.
Are you in reference to this bill?
Yes.
Can you give me a page number and a line number, Nathaniel?
69.
Okay.
Section 54, Minnesota statutes of section 256.93.
Page 69, page 69, what line are you looking at?
Limitations in case where guardianship of any child with a developmental disability or who is disabled, neglect, or of a child born to a mother or who is not married or a child's father when the child was conceived. And then
Can you
we
hold
go
on
down.
for a second? We're trying to find what you're
Okay.
making reference to, so give us a second. I guess. I think that might be different on the guardianship. Elder, would you guys see that? I'm not seeing that. Say that, so look at your, where you're looking at. What line are you looking at? 69 dot what?
Let's go to 69.8, having jurisdiction.
Oh, that's at the original, okay, I got you.
Mr. Chair, is that the original bill?
Yeah,
Rather
that's-
than the A5?
Yeah, that's all.
Okay, that's the original bill. Okay.
Yeah, that's no
I
longer
wanted to
there.
just talk about that real quick.
Go ahead, tell us, what are your thoughts?
I think with guardianship, the Department of Human Services doesn't want to tell you what happens in guardianship. I've had a situation with a guardian who literally put me in a hospital, and let's just say I have family and friends that care about me, and they were trying to get me in a mental hospital, but the problem with that is I was going on a trip. Okay, this is the problem that is happening with disabilities and myself and my former previous group home, my group home right now. What they're telling me is we're gonna listen to the Department of Human Services and not your guardian. That's what I'm getting called on the cell phone. And this is a problem with people like myself. When I listen to the committee, and I thank you for all listening to me, it's getting very frustrating and it's emotional for me because I feel like I come here and keep fighting and fighting for these people with disabilities who cannot come here and stand up because they're in a point of guardianship abuse that is happening in the Department of Human Services. And it's not okay. So my question is, I would love to help you guys, and I would like to share more about my story, but I know I don't have time to do that. I think what we need to do is we need to strike down the conflict of interest and get people who are willing to be guardians and not people like my former state guardian who was willing just to do it for the money. That's what the problem I'm seeing, and this is the problem I'm seeing with group homes that are saying, okay, you have a guardian, but we're not gonna we're gonna impose our own plan. So I can take any questions on the matter. I have worked constantly with the Department of Human Services of Scott County and called their supervisor and said, hey, this is what's going on. And they're like, we'll work on it. They're not working on it. So are you willing to subpoena all of them for them to come down here and testify and say, what's going on? What are you guys doing? So if we're talking about limitations, I think there needs to be strict limitations. This is too lenient for them, and it's going to be really lenient.
Thank you, Daniel. I really, Nathaniel, I appreciate your coming in front of us and testifying. We're going to go on to the next one, but here's what I want to share with you. You, when you mentioned it, it was a lot of technical stuff, and it would be get to work and share with us in the email about that technical, not just, it's great to have the lived experience, but also the technical. If you've got some ideas of how that looks, feel free to email our committee, because that's where some of the best ideas come from, and I appreciate you sharing what's going on.
Yes, I will do that. I probably will set up a meeting with you about that.
You can just email it to us. So thank you for your testimony, and we're going to go to the next one from you. So thanks for coming in today, Nathaniel.
Thank you guys so much.
Appreciate your work. Ms. Clark, Commissioner Clark, you're on Zoom.
I am, Mr. Chair. So, Mr. Chair and members, I'm Terrell Clark. I'm a Stearns County Commissioner. I'm here today remotely, mostly because I feel very sick, and you're glad I'm not there, I'm sure. I'm here today on behalf of AMC, Maxa, and Micah, and very much want to express appreciation for the work this committee is doing. We do have 3 areas that, if you could grant me a few minutes to, I guess, express some hope for continued work on.
It's all yours. Few minutes. How many few minutes?
Thank you.
How many few minutes do you want? Is this old Senate conversation where a few minutes turns into?
I guess the question is, do you want to have a conversation? Or
I love it. It's all yours. It's all yours, Madam Commissioner. Thank you.
Okay, thank you so much. The 3 areas, first off, has to do with min choices. As you all know, the counties are going to continue to work on this issue, these assessments. We've had increased demand for the assessments, particularly for older adults and people with disabilities. Given the current demand, many individuals have to wait to be scheduled for the initial assessment way too long, and counties are falling outside the statutory requirements for those assessments. This is a disservice to the residents and puts additional pressure on staff and on the system. It really has become clear that the system is unsustainable and changes are urgently needed. So we know that you're working on this. We know that it may or may not be full-blown in this bill, but quickly, truly reducing the complexity and increasing the efficiencies of this assessment is essential, and its need continues to grow. So the county proposal is to reduce the unnecessary length of the annual reassessments for case scenarios where the person's needs have not changed, allowing for an abbreviated or shortened reassessment for 2 years in a row, followed by a full reassessment in the 3rd year, allowing the individual to request a full or non-abbreviated reassessment at any time, allowing for a remote reassessment for the 4th consecutive reassessment, if followed by an in-person assessment. The current statute allows 2 consecutive. And lastly, on this piece, allowing for a verbal attestation in lieu of required physical signatures for remote assessments. We recognize we need to keep working with you and others in the department. We believe this will help serve individuals better, be better for the families, and it should reduce some costs. So that's the first one.
Can I go to Senator, Commissioner, can I go with Senator Gruenhagen? You start talking min choices. I look down at the end of the table and you got 2 senators down there that are actually working on that. Senator Gruenhagen, you got a question or a comment?
Just a comment, follow up to reinforce her comments. You know, I attended county meetings during the off session, and when you got to the HHS, they all said they need abbreviated reports for people whose situations have not changed. The current situation, they cannot get to all the people because of the amount of paperwork they have to do. So they're required to do all this, and yet they can't even get it done. So I think what she's saying is very valid, that we need to reduce the requirements for people that they know are in a situation that they will not change.
Yep.
So I just wanted to reinforce what she had to say.
No, I'm glad I think everybody agrees with you. There's some federal stuff on that too. So, but that conversation needs to stay on there. I know Senator Abler's got an amendment, and also we'll talk about that later on. So, Commissioner, thank you. Keep going.
Yes, and thank you for that, Mr. Chair and Senator Gruhagen. It's so hard on individuals and families, and together we can fix this issue. This is one of those things that actually should be able to get fixed. The second area, it happens to be Article 4, Section 5, which has to do with withdrawal management. And the concerns the county have, and we know again that we'll need to keep working with you all on this, is that at this point in time, withdrawal management is considered to be a medical service, which is billable to PMAP or MA, not the lower level of a social service. So it's not billable to counties currently. Not surprisingly, that would be a concern if medical provisions would start being billed to counties. So we're willing to work and kind of try to keep figuring out solutions where parity with private insurance is an issue, including continuing to talk with other stakeholders. So that's the next one, and the last one probably will not surprise you. It's more of a little bit of a flag, which is Article 3, Sections 40 and 41 of the extension of the sunset of the 48-hour rule. And obviously this is a policy bill, so increasing capacity would not be occurring in this bill, but the priority review panel and certainly counties and our county coalition fought hard. We worked hard to get to an agreement that is, this only should be extended for any period of time or changed in any way with the addition of capacity. Again, we're just trying to make sure that we can actually get some capacity happening and recognize that there's other bills that are going to be going through. And with that, I'll stand for any questions.
Thank you, Commissioner. Senator Abler?
Yeah, it's kind of nice we can talk piecemeal about these things. This question about who's going to pay is a question we need to investigate. And so the medical service idea versus, what the substance use thing, where does medical start and where does whatever the county's job is. And we don't want to necessarily add more cost to the counties, but if part of these things is who's the payer of responsibility. And so it's in the bill. I'm happy to think it came out of my bill. So.
It did.
And so let's figure out a way to decide who's going to pay. Otherwise, these people are going to get nothing. And I don't think people intend that they get nothing. But a lot of these folks are medical assistance people or Minnesota Care or something. And so let's sort that out between March and the counties and figure that out. And the other thing about this 48-hour rule, which we could talk about for 48 hours, Mr. Chair, which we shouldn't. I think we're faced with a decision on this committee. I don't want to see the 48-hour rule go away, but it's absolutely unworkable.
Yep.
Unfortunately. And I appreciate, Ms. Clark and the others who say, well, if there's money, we'll do it. It's like, okay, but there's no place to put them.
Yeah.
And so should we let the county be the person that they're going to sue if they're not out in 48 hours? Suddenly I'm like, whoa, I think this is a great idea to just do when we can. I hate the idea that we're finding space when they can get around to it and that there's no leadership from the top. I won't even impugn the person that sits at the very top there, but there's been virtually no solid leadership, and the solutions have come at the mid-level here with the legislature and the counties just trying to get workarounds. And when the DCT is hamstrung, you don't have money, and I toured thanks to the Ms. Briones and others for a really interesting tour of the Miller Building, and so so tomorrow, Mr. Chair, I've got the hearing on the task forces report in State Gov.
Yeah.
I have 5 minutes.
Really?
Yeah, we're going to solve it there in 5 minutes. So all is well. But I think that the only things we have at our disposal are let don't continue the thing for 2 years and keep the 40-hour rule, abolish the 48-hour rule, which we should not do.
Right.
And then the governor provides a chance for the counties to chip in for another 15%, which I don't think we should do that. So anyway, I think this is the only practical answer, sadly. That's all I got. Thank you.
There's also the conversation about, it is a policy discussion and a budget one as well. So I appreciate it. Senator Rasmussen.
Thank you, Mr. Chair. And I mean, if it's appropriate, I do have an amendment on the 48-hour rule, and specifically if we want to talk about that, or I can wait.
I mean, it's up to you guys. Everybody was going to get through the figure, but if you want to do it now, because Senator Abler's talking about it, and he's got an idea, and so do I. So yeah, bring it. So Senator
Thank you,
Rasmussen.
Mr. Chair. I'll move the A11, and as it's passed out, I'll describe it. And so what this amendment would do is it deletes the 48-hour rule delay that's in this policy bill. And I fully appreciate that, having us revert back to the 48-hour rule on July 1 is unworkable. We won't be able to do it. But, Mr. Chair, in response to Commissioner Clark's comments, as a part of the working group's discussion, this was going to be tied in with funding. And so my ask, Mr. Chair, with the A11 is to take it out of the policy bill and to put it in the budget bill that this committee will be hearing shortly, and making sure that we have this conversation about the 48-hour rule in conjunction with funding for direct care and treatment. And that could both be their operating requests that they have, before this committee and the governor's request, or additional proposals for capacity that have been brought forward. So I understand we're going to have to do something with the 48-hour rule. I just would like that conversation to be a part of the funding debate and not separate from it, which is, I think, what we're hearing from Commissioner Clark.
Thank you. Senator Rasmussen.
Talk.
Yeah, I think, so when we were talking about it, let's open up this commission, the conversation on this. There's no reason why, and I've been thinking about this because we have both that policy discussion and finance. I think it should go parallel. We should keep it in policy, but then also bring it into the finance side of it too. And that's just where my thought is, having in both, because the task force did agree on that, the temporary extension, but comes down to how we're going to pay for that. So the policy side of it, I would like to keep it in there and add it to versus not do it here, because let's assume this happens, that we get into a conference committee and all of a sudden, we're up against 1.3 billion in cuts in the other body and 1.5 billion from our, the governor's office. And so what we do here is going to be the best we can do, and it'd be nice. I think it gives us more strength having them both go there. That's my point.
Mr. Chair?
Yeah, hold on, Terrell. We're going to go to Senator Rasmussen, so we're looking at each other talking, but yeah.
Thank you, Mr. Chair. Here's my concern, is that if we have a standalone human services policy bill, and maybe that's one of the things that gets passed earlier before all the budget bills are complete, that this will then be settled before we have the conversation around direct care and treatment funding. And I think what this restructured 48-hour rule looks like has to be talked about in conjunction with the funding. And I think if this committee wishes to fight for additional funding for direct care and treatment in conference committee, I think having the language for that travel with the finance bill is better than this policy bill. Because what I worry about is if the policy bill passes before the budget conversation, then the pressure is off. then we don't really have a 48-hour rule, because this current language of 48-hour rules when a medically appropriate bed is available, that could be 5 years from now. And so I think that's why it's important for us to have this be a part of the money conversation, because that is the problem of why we're having issues with the 48-hour rule. But I'd be curious to know what Commissioner Clark has to say.
Yeah, that's what we were just pointing to. So Commissioner Clark.
Thank you, Mr. Chair, and also to you, Senator Rasmussen. Yes, I was going to say, I do want to remind the committee that the task force recommendations were linked. They weren't separate. These weren't two. If you look at the list, you'll see that there's a number of recommendations. In the body of the report, it talks about these being inexorably linked. And the reason for that is exactly to both Senator Rasmussen and Mr. Chair, your point. It's to create some urgency. If, with all due respect and knowing how hard this is, the legislature is able just to keep pushing it on and everybody just says, hey, we tried, then we're going to keep having people languishing in jails and in hospitals and in other places instead of getting them the needed treatment. So in a lot of ways, it would make sense, and certainly appreciate, Mr. Chair, your thought about carrying it in both places, but it being specifically, and certainly with good precedent, solely in the finance bill would create that urgency, right? It reinforces and shows that, yes, these two have to be done together, as opposed to, depending how the rest of this session goes, this just being left there. Because otherwise, honestly, we're going to be back here in another couple of years having the same conversation. And I well know, and this is just me speaking now, how hard this is, especially if you don't get a good target. We all want to keep pushing for you to get a decent target for this. So help us.
Senator McQuaid, then Senator Abler.
Thank you, Mr. Chair, and thank you, Commissioner Clark. I appreciate, your deep expertise here, and I'll just say that while the priority review panel, their recommendations did talk about funding, the explicit recommendation from this group asked that we extend the sunset provision for 2 years while we develop DCT and community capacity. And so, again, we put together this task force or this work group, and they gave us recommendations. And so I really want us to make sure that we spent time passing that. They spent time putting it together. They came and they gave us the recommendations. And so I continue to get really uncomfortable with doing the opposite of that. And so, if we're not going to listen to the experts when they come together and they tell us what to do, then what's the point?
See, I love this committee. Jim, this it's like, I love this. Two, got McQuaid and Rasmussen. They're throwing the different questions to the table. This is how this is, Glenn, I told you, this committee operates different than anyone else. You believe me now, don't you? I've said that twice now. I love that. Senator Abler.
Well, thank you. Probably the only realistic thing to do is repeal the 48-hour rule, because we can't do it. I don't favor that, but if we can't do it, then we should decide we're not going to do it. I think in this whole budget time, we have to decide what's really important that we do. And I think one of the things we should do is retain that rule. But the task force at least gave a really good balanced thing. There's a couple bills floating around from that. There's been a discussion that never happened before. But Mr. Chair, I don't know if you know, I spent the weekend, and part of why I was so tired, I pored over the budget books, and I found how much money is available to work on this very thing. And so there it is. Zero. Oh, wait, there isn't any. And so we could, in fact, so to Ms. Clark, the governor actually shifts $460 million to you in costs. That's nearly enough to pay for Senator Hoffman's budget. And so, target. And so if we did that, probably we could find some money to buy a $50 million project somewhere. But not to be too facetious, we are just in a world of practical hurt. We're going to kick the can down the road, Mr. Chair. The governor's decision was to kick it down the road and saddle the nice people at DCT up there to make them come to all these meetings. Just was thinking, is this improving our ratings or harming our ratings, talking about this again? And I wonder if the audience out there is kind of keenly interested in this. If we're picking up viewers online more,
we had more during that time. We had more viewers watching the committee 5-6 years ago than they actually had the National Congress one time. That's how people wanted to engage in this conversation. But I wonder if I appreciate it.
But anyway, so just not to be facetious, it's, but we're stuck with this, and I don't think the amendment, I think we should put it in both places. And just to Senator Rasmussen's concern, in the event that this bill becomes law, we can always, in the budget bill, we can always say, didn't mean it, here's some money. But I don't think it's, otherwise we're opening up all these counties and states or somebody to virtually lawsuits virtually for what was not done that they had the entitlement to.
So go back,
I'm done.
no, go back to your,
hold this-
your rationale,
want
no,
this
the rationale about, you said, because I was thinking it should be in both, but mine was about leveraging, but yours is no, we do that, and then if we get to the budget and this doesn't exist, then we're gonna have to pay for this, right? I mean, that's, and so I'm tracking your logic now instead of mine, which stays in both. We actually move it in both and not just in one.
And Mr. Chair, the
is what
more
he's
policy
saying.
things we can get out of the way and create some kind of certainty for people.
Yeah.
At least that way, there's a fallback. And I don't think anybody wants that, but I'm just,
No, I know.
I've repeated
Okay.
myself enough times.
No,
so
you're
thank
good,
you.
you're good. Senator Mayquid.
Thank you, Mr. Chair. So I just want to make sure that I'm hearing this correctly, that the recommendations from the Priority Admissions Review Panel, we're not going to take them, because they explicitly said, recommendation number 2, continue the current medically appropriate bed language in statute for 2 years. This provides time to invest in expanded capacity in DCT and the community and to measure progress. And Mr. Chair, I did dig into the budget books. And I found we could repeal one tax expenditure and have $230 million. And I bet you we could do a lot with DCT for 230, it's data centers. Just one tax expenditure repeal, just one. I didn't even dig into a book, it was half a page. Anyway, I guess my question is, between you, Senator Abler, and Senator Hoffman, and Senator Rasmussen, I understand what your amendment does, but I feel very strongly that we should take their recommendations, and this is not those recommendations.
Senator Rasmussen, now you've heard from 3 of your colleagues.
Thank you, Mr. Chair. And I would say, the bill before the committee does not take the recommendations. This is just one, this is coming from a direct care and treatment policy bill, is my understanding. This is not taking into account the broader task force recommendations. And so I don't think it's fair to say that just because we're taking out a provision in a direct care and treatment policy bill that we're disregarding the recommendations. I actually think it allows us to have a broader conversation in the budget bill about incorporating more of the recommendations from the task force, which include increasing capacity. And I think, Mr. Chair, if this stays in here and the policy bill passes and gets signed into law, then the pressure's off. There's no need to push for then that operating budget for direct care and treatment, because, well, why does it matter if someone is in the Otter Tail County Jail for 100 days waiting to get into direct care and treatment? I guess that's okay, because we're not going to get sued about that anymore because
of that.
the direct care and treatment policy bill, got signed. So that's my concern is again, we're going to have to do something with the 48-hour rule. I support taking what the recommendation of the task force is. I just think we should do it in the budget bill.
Just in the budget bill, is what you're saying. And Senator Abler's saying put it in both. Okay. So,
Mr. Chair?
go ahead.
I'm so sorry. Just for clarification, as a member of the review panel and as a member who worked hard on this, they were linked.
Yes.
What's hard, I will tell you, the lesson I have learned, while I'm a big believer in bold, what things that somebody's eyes can go through in a report and you can see it, is that we should have pushed at that, 11th hour and 59 minutes to make sure the full sentence was in that heading. Because the recommendation is linking it. It extends it. 1 is the increase in the capacity. 2 is the extension. And the sentence under that number 2 specifically says must be conditioned on funding to increase capacity at DCET and the community. So just want to make sure that everybody knows that that's what the agreement and that's what the recommendations were. You're going to have to, I know you're going to have to do what you think you need to do at the end of the day, but we're going to continue to work hard to increase capacity, and what the recommendation was linking them.
So, thank you. Senator Abler.
Well, I just don't understand the alternative. This was a compromise I didn't like when we did it a couple of years ago.
Yeah.
But so are the counties and the task force saying, well, then let's just go back to the 48-hour rule, period?
I don't think so. I'm not,
No,
Senator.
but there's no money.
Correct.
So the money you want, we can't buy the house you want, so you don't want any house. that's not a very good analogy, but this committee On Friday, Senator Pappas met with Ms. Abderholden and some promoters of building a 50-unit thing at Anoka. But that's $75 million in a bonding bill that's 700.
Yeah.
So
Not gonna happen.
tell me who wants to forego their project to build this thing?
Yep.
And practically speaking, and I don't know, the governor, and so the discussion was, the governor has 3 priorities. This wasn't any of the 3.
None.
And so, to be practical, so let's pretend there's no money, then let's talk about it. But whatever, I mean, we've beat it up well enough, we could vote on the
No,
amendment.
we're good
But
on
I think
time.
that
But these are the hard conversations this committee
This
has
is
to deal
like
with.
one of the
No-
biggest conversations to
Yes.
have and one of the hardest to solve.
Yep.
And maybe we should give the counties a 50% share, Mr. Chair, and then we could take that money and buy some more space with it. What do you think? Would that be a friendly amendment?
I love those kinds of amendments.
Ms. Clark's going to quit talking if I keep bringing it up.
No,
so thank you.
Senator Rasmussen.
Thank you, Mr. Chair. And I just, for the committee here, I have the report recommendation where it says, extend the sunset provision for 2 years, during which time the legislature must develop DCT and community capacity. And that next 2 years is our budget cycle, right? And so if our budget bill doesn't work on developing DCT and community capacity, we're not following the recommendations. And in the sub-bullet, it says immediately begin to increase capacity of direct care and treatment. And I would say, there will be items in our budget bill that are spending new money above forecast. And I think when we look at direct care and treatment, it's a place that we have to make sure that we're investing in. And does it mean that it's going to hit the full recommendation in the first budget cycle? No. But I think we have to make sure it's a part of the conversation on taking some action.
Mr. Chair.
Senator McQuaid.
Thank you, Mr. Chair. And I appreciate that because I was looking at the PowerPoint and not the specific report. But I had a bill in front of this committee. It didn't spend new money. It reappropriated old money to look at specific buildings to increase the capacity for DCT, in particular for youth. And so well, it's old, it's money, it's already appropriated. So it's just, old money reappropriated something else. And so I guess what I'm trying to say is that I don't think that if it goes, I don't think anybody is sitting around being like, oh, if it goes away, we don't have to worry about it anymore. It sounds like everyone feels a lot of urgency around doing something around this. And so I feel like I'm doing a piece, and it will hopefully be in the budget bill, and hopefully there will be other pieces too, but I don't know if we need to link them as in they're in the same bill. I think they just need to be linked in the time frame that we're doing it.
I think it is. I think we're, yes. Advice? Yeah, I think we should. The A11, nobody else has got anything to say. Senator Rasmussen renews his amendment to pass the A11. All those in favor say aye. Aye. Opposed, same sign. Aye. No. I know. Senator Rasmussen, I don't think your amendment passed. Is that okay? Well, it is what it is. I mean, this is what this committee is about. No, we're good. So A11. I think we should make sure there should be in both places though. So thank you for that. Terrell Clark, you want to get Jill Pooler up, and then Sean Burke. Jill Pooler, you want to go first?
Sure. Hello, Mr. Chair and committee members. My name is Jill Pooler, and I am the Aging and Disability Services Manager at Wright County Health and Human Services. And I'm also here on behalf of MACSA, Minnesota Association of Social Service Administrators, as well as MICA, Minnesota Intercounty Association. I don't have any additional formal testimony. I was here more in just as an effort to echo what has already been stated by Commissioner Clark and others, and then just to basically be available for questions should there have been more detailed questions for county-specific information. But since I have the floor, I will just take one moment to say and bring us back to that min-choices conversation of this bill that we're discussing, and just really, again, hit home the systematic struggles that are involved with the min-choices assessment completion problem really do impact our most vulnerable folks, and we do need to take action. We took some action last year, which was wonderful and was a starting in the right direction. but we need to really make sure some kind of action is continuing to be taken because we can't continue to stay at a stalemate. It's not fair to our county residents and the people that we're trying to serve. We know actions will have a cost, and we know we're in a really difficult time budget-wise, but still doing nothing is definitely going to create a higher cost at the end for our constituents. So thank you for your time.
Appreciate your work, Jill. Thank you. Good to see you again. How are things out in Wright County? I believe there might be a Min Choices amendment coming on this committee sometime, and the discussion will be just as exciting as the last discussion we had. Sean Burke, welcome.
Chair Hoffman, members of the committee, thank you. My name is Sean Burke, here on behalf of the Elder Justice Center and also a coalition of consumer advocates. I want to thank you and members for many strong and good consumer protections in this bill for residents of long-term care facilities, especially assisted living. I wanted to just briefly highlight some changes in this bill that are extremely timely and important. Even if they may require a little bit more work this session. I'm referring to the articles around the use of restraints in assisted living. So this is in Article 2. The most important section is Section 36, but there's some other sections that go with it. We're looking at page 45. In 2019, when the legislature passed the assisted living licensure bill, there was one glaring omission, and that was around the use of restraints. Parties at that time understood that this is a complex issue, and we needed to get it right. But up until this year, the statute 144G is still silent as to restraints. So there's no prohibition, there is no guidance. And this is not a long-term tenable.
Sean, repeat that again. Repeat what you just did. So 144G is what?
Is silent as to the use of restraints. There's no prohibition. There's no guidance as to when it could be used in emergency situations.
Okay, thank you.
So this is not a long-term tenable situation. Providers need rules of the road. Advocates and consumers need rules of the road, and MDH and the regulators need rules of the road. The only tool they have at their disposal is the use of a maltreatment report, which many times is not sufficient or is not the right tool for regulating restraints. So the language in the bill does represent work that MDH has done in consultation with consumers and providers, and also importantly DHS. From our perspective, the consumers believe this is good, strong language, but we are open to continuing to work with it this session. We do think another session without these rules of the road is not a good outcome for anyone, and so we strongly urge this committee to pass this language on and continue to work on it if necessary. Thank you.
Thank you, Mr. Burke. Members, any questions for Rasmussen's got a question for you. Senator Rasmussen, Sean, stay here.
Thank you, Mr. Chair. And maybe this question is for Mr. Monahan. The language that Mr. Burke was talking about in terms of the restraints is, what bill is that coming from?
Mr. Chair, Senator Rasmussen, the language originated in the underlying bill, but it was modified quite a bit through my interactions on behalf of the chair with the Department of Human Services, Health.
Senator Rasmussen? No, you're good.
Mr. Chair, members, the heart of it is on page 45.
Of the A7.
Of the A5.
Yep, A5.
Mr. Chair.
Senator Rasmussen.
Thank you, Mr. Chair. And I don't have anything further on that. I just wondered if you wanted to start entertaining some amendments.
Absolutely. We're at that point where you can, sure, you got some more?
Yes, Mr. Chair, I'd like to move the A15.
A15. You want to pass that out, or do folks already have that?
It'll be passed out, Mr. Chair, and I can describe it while it's being passed out, if that's
Yep,
okay.
Please, thank you.
So, Mr. Chair, this amendment would allow the Commissioner of Health to grant a variance or waiver from the physical plant and design requirements for both nursing homes and assisted living facilities for buildings that are on the National Register of Historic Places. And the Commissioner would have to evaluate granting that waiver based off of a number of criteria. First off, on whether the waiver would adversely affect the health, treatment, comfort, safety, or well-being of residents. Second, whether alternative measures can be taken. And then lastly, they have to take into account whether or not compliance with existing or alternative equivalents would impose an undue burden on the facility's efforts to preserve the historical integrity of the building while providing those services. And Mr. Chair, the reason I bring this today is that there are some facilities in the area that I represent, specifically the facilities of the former state hospital in Fergus Falls, that are on the National Register of Historic Places, and there is desires to have those facilities be offering nursing care or assisted living services. And this would simply give the Commissioner the ability to take a look at these unique situations and others like it, and if appropriate, if in the interest of the residents, be able to grant a waiver. This process is similar to undue burden waivers that the Commissioner of Health has currently. I think this would be a good marker to show that we care about preserving historic buildings when possible.
Members? Senator Maquay, then Senator Abler.
Thank you, Mr. Chair, and Senator Rasmussen. I don't have a philosophical opposition to this. I'm just wondering if you could give me some examples of what kind of variances or waivers what we could see that wouldn't, like, it's not like asbestos floors, right? Okay. Give me some examples.
Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Senator McQuaid. Sometimes it can just be structural. You know, some of these buildings that are over 100 years old just weren't built the same way that you would build a new facility today. And so just acknowledging that sometimes structurally certain changes can't be made while maintaining the historic nature of the building. Sometimes, like certain roofing requirements, like for example, I think there are some requirements against having a wood frame roof, and so that would be an example.
So we've had this conversation about some of these buildings that we have when we talk about 351 beds. My question to Senator Rasmussen, do you know if there's a cost on this? Do you know, does this fit our policy book only? Is there a cost? I'm looking for a head shaking. I got no's back there, so guess what? Are you with the Department of Human Services back there?
Mr. Chair?
Yes, go ahead.
It's my understanding from the Minnesota Department of Health that there would be no cost on this. And I also just want to say I've committed to Senator Wickland, because this is impacting the Health Committee, that if there's any changes that need to be to this language going forward, that I will take any technical assistance or changes that need to be made.
Answer the question. All in favor of the A-15s signify by saying aye. Aye. Opposed, same sign. Thank you. A-15 is added. Nice job, Senator. What's next on your bucket? You want me to go down the list that I have, or do you guys all?
Mr. Chair, I have other amendments, but I can let other members of the committee go ahead if they'd like to.
Sure. I got A9. Senator Mohamed, you want to do your A9? You presented it in front of your bill, and you said, wait, I got this is for later.
I apologize, Mr. Chair. I was zoning out. I have the A9 amendment.
Do members have a copy of the A9? It's coming. Go ahead and tell us about your A9 while the language comes out.
It basically just includes the bill that we just heard, the swimming bill, into your omnibus bill.
Oh.
Thank you, David, for all your help.
David helped with this. I love that.
Sure did.
It's a straight-up policy bill, too, isn't it?
Exactly. Has no fiscal note,
That's pretty brilliant. You got to admit, don't you?
allegedly.
You're
Mr. Chair, I apologize. That one is a fiscal note. It's the substance, it's a substance one.
Oh, it adds Senate File 2805 and Senate File 3172 to this. That's what you're saying.
And that one for sure has no fiscal note.
And we know that on all those. Wow, that's pretty brilliant. I'm impressed. All those, everybody got thumbs up? All those in favor of the A9 amendment, say aye. Aye. Opposed, same sign. Look at I even knocked it before it do. Let's go to the A10. Rasmussen, you want to pull that one up, or you want to?
Mr. Chair, I think we're going to have Senator Utke go with an amendment.
You want to go, is it Utke?
Yep. Mr. Chair, that would be the A16.
I'm looking at it. Senator Utke, talk about your bill as they pass it out.
Thank you, Mr. Chair. This amendment strikes language that is just not ready to move forward at this time as we see it, or as I see it. Members, we just had this bill a few days ago. There were a lot of concerns about this language, and it's had multiple stops, and the concerns have continued. So as people get it, you will see that we are striking sections 8, 9, 10, 11, 20, 28, 33, 34, 37, 38, 39, and 40. So we just made your bill much smaller. But anyhow, again, it's just that at this time, there was a lot of things in it that, one, there's still some disagreements and concerns on, and it was related to our assisted livings, and we just can't tie their hands anymore until we need to, if we do anything along those lines, we need to have agreement from all the parties involved, and at this point, we don't. So that's why I'm with this A16 amendment, I'm suggesting we pull that language back out. If people want to talk about it again next year or whatever, but there needs to be agreements before we push something through and put it into law. So thank you, Mr. Chair.
Thank you, Senator Utke. We got, I think, Senator Rasmussen and then Senator Gruenhagen. And I did note that you retain hospice patients' rights in your in this, that you do retain that. And so I know Senator Abler has been in contact with the folks. This started in when was Karen Housley the chair of our elder, whatever that committee we had. That's how long this conversation has been going on. So I understand that. Senator Rasmussen, Senator Rasmussen, Senator Gruenhagen, and Senator McQuaid.
Thank you, Mr. Chair, and thank you, Senator Utke, for bringing this amendment today. And I think if we go back to when the core components of this bill were heard, we had the Minnesota Department of Health come up to the table, and they basically said that they were, unaware of, what was kind of going on with this bill and hadn't necessarily had a chance to review it and know the total impact of it. And so that just is concerning to me. And I think if we're going to have a proposal that is putting, new regulations and restrictions on, especially in a very comprehensive way, that we should have some more feedback and engagement, both with the actual regulator, being the Minnesota Department of Health, and then also from the providers themselves. And I think the A16 amendment takes out some of the more controversial pieces while retaining, I think, some of the pieces that we all support, which is on the hospice care piece still in the bill.
Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, I would urge support of Senator Utke's amendment. I did go back and talk to the individuals who testified that time about the concerns on this bill. And I asked them if there was any peace in the valley between what their concerns were and the author of the bill, and they said no. So they have a lot of concerns about complicating the increased cost and the mandate on this. And I think at this particular time, we should remove this part out of the bill. Again, you could call them up here to have them testify if you want, but that was basically their input. So
yeah, and if you want people to come up, Senator Gruenhagen, that's the history of this committee is, if you want somebody to come up and talk, you sure have the right to do that anytime you want. That's never stops it. But if you want to think about that, I see Sean Burke is here, and who else is in the back? If you guys want to dialogue with this, let's go to McQuaid, Senator McQuaid, while we wait. So thank you.
Thank you, Mr. Chair. Senator Utke, line 1.4 of your amendment is on. It's deleting page 31, section 9, which the new language there is a resident has the right to be free from retaliation. Is it really not ready for prime time to say that residents should be free from retaliation.
Senator Rasmussen, and then Lisa, do you want to come down, or somebody from MDH? Because I know Senator Dibble is working with you guys, I guess. So let's try to, if you can't clarify it, then we're beyond that conversation. So just Senator Rasmussen to Senator Makewaite, or Senator Utke to Senator Makewaite's point.
Well, thank you, Mr. Chair. The whole thing was kind of in a package, but the President has a right to be. I mean, we can probably agree that, I mean, there shouldn't be any retaliation, but there's more to this full conversation. It's a full package. It isn't just one line. And I don't think the whole thing as it's presented and as we see it here, it needs to be worked on. And that's why the amendment is as it is. It needs further conversation, all the way from what's in here to the fact of who's regulating it. And we had a major gap there that MDH wasn't even involved yet. So,
thank you. Senator Rasmussen can go to that question. Glenn, unless you want to go to that question, or do you want to add? Because Senator Rasmussen specifically is going to that question. Okay.
Thank you, Mr. Chair.
I wanted to go to that question.
All right, let's go Senator Rasmussen first, then Glenn, and then go to you. Is that cool? Thank you,
Mr. Chair. I just wanted to add that the Vulnerable Americans Act already has protections, and they're not allowed to retaliate. And I believe, even though I don't serve on the Judiciary Committee, that this was kind of talked about, and typically the Senate doesn't do policy statements, but that's, if you look at page 31, that's why there's already existing language on retaliation against a resident. So I think, again, that kind of goes to show that there already are protections against retaliation, and so opening up questions on why the new language would be needed.
Glenn, go to you, and then to Jim after that.
Yeah, I basically was going to say something very similar to that, so I'll leave it at that. But there are a couple individuals back there who could probably add to it if you want. But
you want to bring them up, then have them come up. I mean, more than that, it sounds to me. So I know Senator. Let's go to Senator. So we did. Abler, you want to go? You're after Glenn. So as those folks you want, bring them up here, Glenn. You know who they are.
Do you want to come forward?
So, Mr. Chair, I'll just offer a comment on the big picture for starters.
Go ahead, Senator.
Well, I think that, some of these actually are kind of nice, this visitation thing, that comes up all the time.
Yeah.
And so, maybe we could just even go section by section, and do you want to get rid of this one? And just to kind of keep some of the good things and more discussion. Some things, I think the district court and all that stuff is probably kind of heavy, and I don't think we're in a position that people get sued over that, but that might be heavy. But I think some of this is kind of
This is why we
meritorious, at least for a while, and then it's going to move forward. And so if I could move to divide the amendment, but I would just suggest that we kind of go through item by item. They're kind of distinct, and I think we might agree that, that's district court's a little much, but maybe retaliation.
You mean actually build a bill in committee like that? What we used to do, Jim? Is that what you're talking about doing? Like work on
So do you want to? Should we just do
I'm trying to be funny, but yes, I like that. You guys want to get Sean, is Susie Scheller around, or?
Yeah, so, Mr. Chair, so if I could suggest, and I'll move if you want, but let's just talk about section 8 first. Okay. See what that is, and at least then we'll move through the list. We don't have to spend all day on this.
Let's go ahead. I'm in section 8. Yep, go ahead, Jim.
I don't know, so, anything wrong with that? It doesn't seem like it's bad, so that's my question.
Tell us who you are.
Thank you, Mr. Chair, members of the committee. My name is Erin Hubert, and I am here on behalf of Long-Term Care Imperative. Mr. Chair and Senator Abler, I do believe we supplied the committee with a list of our areas of concern and areas of support. And I believe in that letter, it indicates that the concern with Section 8, consent to electronic monitoring, is that it allows the potential for a family member to circumvent clinical expertise and does ultimately remove autonomy and agency from the resident themselves. So seniors should retain the ability to decide whether they want monitoring in their own home or not, even if a family member or somebody else would want differently for them.
Senator Abler?
Oh, so that's this actually allows that the person would not be consenting, but their guardian would say they want to have a monitor. So that sounds like that's maybe a problem.
Yeah, this is what bothers me. We've known this existed for years, right?
Yeah.
We've had this conversation since, remember, you and I got yelled at for going off in the corner and having a conversation. It was too,
Yeah.
over there. And here we're sitting here again, and now I'm sitting here asking, Sean Burke, you want to come up here? Where's Susie Scheller? It's like, why am I having that statement from up here when clearly we're going to divide these, right? And we have some contention about this language that's in there. I'm not feeling resolve on any of this right now, Jim. I mean, that's the thing that's bothering me, because they're coming up. Jordan raised Senator Rasmussen. I better be, formal, because we are the upper chamber. But it's like, where is that conversation happening outside of this committee on the people that are involved day to day, right? And I guess that's just what's really frustrating for me right now is which I'll do, we'll sit here and do this, and ultimately we will make a decision as a committee. I don't have a problem doing that, but I just am sharing with you just how frustrating. So Senator Rasmussen, then Gruenhagen.
Yeah, Mr. Chair, and I think everyone in this committee shares the goal of protecting vulnerable Minnesotans and making sure that especially entities that are receiving public dollars are providing high-quality services. And what I would suggest here is I think this is a prime opportunity for the regulator, being the Minnesota Department of Health, to convene and to say, if there are gaps in their current regulations, what are those gaps and what should they be? And I think it also needs to be done comprehensively, because I worry that year after year, session after session, we just continue to add on more regulations, more training requirements, more restrictions, and we don't look comprehensively at the risk that is out there, and making sure that we have regulations that are going after high-risk situations, and perhaps looking at requirements and regulations that are low value add, that don't really address key risks that people face, and actually removing some of those. And so I think this is where you could have the regulator convene, evaluate, look and see if changes need to be made, and prioritize those in a comprehensive manner versus just having them piled on year after year when we're hearing from providers that they're struggling with this issues. And also, Mr. Chair, I think when we look at the budget situation too, it's not like providers are going to be getting a lot of new money coming out of this session as well. So to be giving them more requirements, more regulation without thinking about it comprehensively, I think would be a mistake. There might even be some good ideas in here, but I just think they need to be vetted and talked about comprehensively.
Thank you. Senator Gruenhagen, then Senator McQuaid.
Oh, thank you, Mr. Chair. Yeah, I would sincerely appreciate, I guess I identify with Senator Rasmussen that we do a comprehensive approach. I mean, we can piecemeal this stuff through, but at this particular point, my nursing homes are right up to here with any more requirements, okay?
Yeah.
And again, we want to protect all residents and vice versa. But the thing is that I would certainly, if we do adopt any of the ones that Senator Utke's amendment would remove, that we would certainly have the perspective of the two testifiers in front of us on that. Because if you remember when the bill was being offered, there seemed to be a lot of disagreement on the impact of a lot of the provisions. And I think the last thing we want to do is complicate things more for our nursing homes when they're already struggling to stay in business in many cases. So anyway, those are my thoughts.
Thank you, Senator. And sorry, Senator Wickland, I'm going to come to you. I wasn't paying attention down there on this one, but Senator, that's it. Senator McQuaid.
Oh, thank you, Mr. Chair. I've spoken so much. Could
You want to
let
go
Senator Wickland go first.
Go ahead, Senator Wickland. Thank you.
Well, I just want to, say I think that, Mr. Chair, that we're talking about an amendment that pulls all of this out, and yet I'm seeing in the letters of support for the bill, I'm seeing specific language or specific references to these sections, and I can't, it's hard to go through and identify all of them, but I mean, for one, Article 2, Sections 9 through 11, we appreciate the addition of retaliation language, and it goes on to describe why it's desirable to have. So I guess I'm a little concerned about just adopting an amendment to pull all of this out when people have gone to work to, try and figure out what the language should be and advise you on, what to include. That's just one letter from legal aid, but I know there's a letter from
that represents the opinion of ARP that references some of these same sections. And it's a little hard to go through and talk about, you know, all of them right here, but I do see support for them. So the amendment to take everything out seems overly broad to me.
Thank you, Senator Wickland. Is it worthy of us having, I don't know, Senator Dibble was working with MDH on this stuff. Does MDH want to comment, or they do not want to comment about this? No? Okay.
No, yeah?
We're going to rock,
Senator McQuaid.
we're going to rock, paper, scissors.
How they decide.
That's good, Senator. That's fine. I pretty much, thank you, Senator Wickland, for your comments. Senator McQuaid.
Thank you, Mr. Chair. I think, I understand that folks don't like the language, but it did get a hearing. We did have hearings. We had testifiers. We had a number of testifiers come through.
Yep.
One of the pieces that I'm particularly not wanting to remove is this part about arbitration. This is on page 40, 40.11, that you don't require any resident or the resident's representative to sign a contract requiring arbitration as a condition of admission. I mean, what could be the opposition to that? Mandatory arbitration has been some of the worst corporate behavior that we've ever seen in the way that people exist in this world. I'm not sure why we would oppose not requiring binding arbitration for a senior to be admitted to an assisted living facility.
Yeah. That's doesn't happen. You guys going to answer that for Senator McQuaid? If you want to answer. If not, I'm going to go to the Department of Health and ask them what their opinion is on this conversation we're having.
Mr. Chair, Senator McQuaid, again, much of this happened pre our times in these positions, so appreciate a little bit of grace. But
We are. It's just, welcome to our committee. There's nobody personalizing any of this conversation up here, so
the
we're good.
conditions and the use of arbitration were very carefully constructed when the law went into licensure in 2019, and a lot of the issues in the provisions that you're discussing within the scope of the A16 were not brought through the MDH stakeholder process that they have been convening over the interim for the past few years. And so in our view, this didn't really get an opportunity to have a fair discussion and a fair debate about whether this is the appropriate thing to do or not.
Senator McQuaid.
Thank you, Mr. Chair. And I, so many folks who sit in front of me in committees know that they bear the brunt of what I'm saying about your clients, not you personally. And so I know you know that. But I mean, tell me what would the debate be? What would be the argument back? I mean, binding arbitration really truly is like a heinous practice that consumers are forced into constantly as the terms of use to use the things that we live our lives. It takes away a lot of opportunities for justice for people who are wronged in many ways. Why would there be opposition to prohibiting that from being a condition of admission? It's not saying you can't have it in other places, but prohibiting it as a condition of admission. What would be the opposition to that?
Interesting. Ms. Hubert. If MDH, if you want to respond, just give me a sign up on stuff. But if not, I'll just keep you there until we start asking. I mean, I appreciate you coming down.
Yeah.
You want to respond to the question that Senator McQuaid asked, or do you want to?
I do not.
Okay, that's good. Well, then, Senator Abler.
Well, thanks. I think of anything in there, it seems like that arbitration thing is something I'd like to retain.
Yeah.
Just to keep talking about it. I
agree.
haven't studied this section, and if there's some things, I don't think the district court stuff and suing and, there's things I wish we could do, but we're requiring training, and their world's going to get much more difficult, and you want them to be able to have training on cleanliness, and, so I think there's some
good stuff in there to retain.
There's
Jim,
a little bit,
yeah.
So I don't know, I'll kind of take your judgment on it, but I think just saying retaliation is bad, I don't know why that's a bad thing to say, like Article 9.
So I'm almost tempted to throw this one, before I go to you, Senator Gruenhagen, if I could throw this out. I mean, it sounds like there's a mixed conversation, so we could take this up, and Senator Rasmussen, it would be 4-4 right now, right? Which means your amendment wouldn't pass. However, if there's, oh yeah, I'm sorry. I have Jordan's name in front of me. Sorry about that. You know, this guy, why did we move him down there? He should have been right next to me. But if, that's the case, perhaps knowing what we do know, I know Senator Dibble is working with the Department of Health continually since our last, because he promised us he was going to get the fixes, right? And to what Senator Abler's point is, there's some stuff in here that we should retain. The other stuff, like you say, needs to be worked on. Perhaps we either A, withdraw this with the commitment that everybody's going to have some homework on this to either bring those changes at Finance Committee, right? Or bring it to the floor. Is that fair? This will go straight to the floor. Bring it to the floor. Is that a fair assumption? Senator Rasmussen, Senator Utke? You want to go to Rasmussen first?
Thank you, Mr. Chair. And or Senator Utke, would you like to go first?
No, go ahead. You started. I'll follow you.
So, Mr. Chair, I think this just kind of underscores the problem with some of this language. It's not that there isn't some good things in here.
Oh, yeah.
But there's just uncertainty around, is this the right thing, and has it been looked at comprehensively? And I think it would be a mistake to just say, well, we're going to pass it out of committee and we'll deal with it later. I think if there are items that are ready and are vetted and have the support of MDH, then those are things that we could bring as amendments on the floor. If there's language on anti-retaliation language or against binding arbitration, that's something we could add in later versus have a bill that's not ready leave here today. And Mr. Chair, I just wanted, because we have the Minnesota Department of Health here at the table, just wanted to ask, I mean, is anything that's, in this amendment that's impacted by it, is anything here an MDH policy proposal?
Can you state your name, please?
Chair Hoffman, and my name is Daphne Pons. I'm the State Executive Operations Manager for the Assisted Living Program at MDH. To answer your question, Senator Rasmussen, we have been working with Senator Dibble. We've been providing technical assistance, and we're more than happy to continue to provide that assistance and work with all parties involved.
Senator Rasmussen, to that point.
Thank you, Mr. Chair, and a follow-up, and thank you for coming up here. And does the Minnesota Department of Health support this bill? Are they asking us to send this language and pass it into law, or do they not have a position, or just want to understand where the department's at?
Chair Hoffman, Senator Rasmussen, as I said, we've worked with Senator Dibble and provide technical assistance, and we're happy to continue to have more conversations. We've not taken a position on the bill.
So they're neutral on that list.
Yeah.
Go ahead.
Thank you, Mr. Chair, and I appreciate that. And I think what I'd say is, again, MDH is the regulator here. They're the ones that get to inspect and make sure that the safety for Minnesotans who are in assisted living is preserved. And that's why I think I'm skeptical of some of these proposals when you haven't had the Minnesota Department of Health say, hey, this is a concern. We want you, the legislature, to address it. We're seeing this on the ground, and just have that comprehensive feedback mechanism, I think, underscores some of the problems.
Senator Utke.
Thank you, Mr. Chair. And just continuing on with what I'm hearing. Personally, the way the amendment's written is the way I like it, getting rid of all this. But if we're going to have a stumbling block and we need to carve something out, I guess, Mr. Chair, I would have to be open to it, because that would save the rest of this amendment from going down. And then we can continue the conversation, because I think there's problems with all these pieces. That's why it's in the amendment, at least from my point of view.
Okay.
But I would take your direction to see what we can move through today, and we will work on the rest of it, because the fact that we're having the conversation around the table is the same thing we're seeing from the providers. There's not peace in the valley on this. There's a lot of challenges out there, and we got to make sure that we get it right, and that was the reason for the amendment.
Thank you. Senator Wickland.
Mr. Chair, I just want to say I don't think that asking the department to weigh in, to support a bill is really the point right here. I mean, if there is work going on and the author has determined that they have, negotiated with parties and they've developed language, the department is responsible for implementing it, but they're not going to say, they support it. So I don't agree with that criteria for examining, what should stay in. And I think it's challenging on the floor to add amendments like this, because then, then it's just up to the person bringing the amendment forward. We don't have the opportunity to hear from any other stakeholders or anybody else who's been involved. And I hesitate to take everything out in the committee and then, and then try and add things back in on the floor when the author has probably worked with stakeholders to come up with what's included in the bill.
Thank you. Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, there is already in statute a arbitration clause. And I guess I'd ask staff to contrast what's in the current bill with our existing arbitration statute, if they can. So you're already addressing arbitration in our current statutes. And what is the new language going to change? Unless.
Sorry, Glenn, I was caught up in, she's got a couple bills set up, so I'm open. I like to work on this completely, right? And where we go, I mean, it sounds like we're split on doing it. Senator Wickland is making lots of sense, saying it's harder to add things back in afterwards. And if you got a commitment, I like where Senator Abler's saying you want to break this out and work on it piece by piece. I'm open to anything this committee wants to do. I mean, if we go to a vote, I'll tell you right now, it's going to be 4-4. It means his amendment dies. So, Senator Abler.
Well, Mr. Chair, and if that's the way it's going to be, and I actually might be surprised, I might vote with you on parts of it, but so the Senate, the House is going to have a much more stringent view of this. Just to caution you as a chair, this, if the provisions are in there the way they are now, you'll have less support in the Senate. It'll still pass, and I may vote for it anyway. But I mean, it's getting late anyway. We have other things to talk about. But it sounds like if it's going to stay the same as it is with a piecemeal thing or whatever, if you don't want to take anything out yourself, then it's going to be a 4-4 thing. And so I just think for now, Senator Aki should withdraw his amendment. And and if Senator Dibble can understand this is very controversial,
Here he
there he
comes.
is, and that it needs some work. And so if he could on the floor pull out some of the things that everybody realizes aren't quite ready for prime time. That's just my practical suggestion.
So do you guys want to make room for Senator Dibble to come up? Thank you, Senator Dibble. Nice to see you. This has been the biggest conversation all night, and this is why our committee exists, but I appreciate this. This debate goes back, I don't know, 10 years, Jim? I think this is...
Yeah, no, it's long. Yeah.
Have you been listening?
I have not. I was alerted that the discussion was happening, so I came flying down here to see if I could answer any questions or shed any light on any.
So Senator Utke had some concerns about the ambiguity and has moved to delete sections, Article 2, 8, 9. Do you have everything in front of you that you need? But it's basically, it's the majority of your bill except the retaining the hospice patient rights. Then Senator Abler has brought about, well, wouldn't we want to keep certain things in here, and I agree with. So we were just discussing whether or not we want to break this bill up, or, if we go to just as it is, it's 4-4, and it just, the amendments, but there's some legitimacy to some of the concerns, there's also some legitimacy to what we've been talking about, the things that are really good within that. And I think that's going. Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Senator Dibble, for coming down. Question for you, Senator Dibble, on your bill that's included in the delete everything amendment before the committee. Are there any components of it that you've been able to work with the provider groups on and come to consensus or peace in the valley that this is something that would make sense and that they're okay with?
Thank you, Mr. Chair. I know that they're having conversations between elder voice advocates and the provider groups. And in fact, I was just going to review I wasn't in those conversations myself, but language is coming forward. I have another hearing tomorrow on Senate File 1918 and then another subsequent hearing. And we're going to bring some of those changes back here, I thought, ultimately as well. So I was going to try to scan. I've been scanning some emails. I know that there's been some conversation. I was going to try to refresh my memory on what those elements were.
You're the chair, you say.
But didn't quite have the opportunity to do so because I thought I had
No,
some
you're
time
good.
tonight to do that. So
You're busy, but we just said, here's what, I'm glad you're here, because then it's prompted a conversation, because Senator Abler did talk with Ms. Scheller, right, and was talking about some of the provisions, and you had the commitment that some of the concerns that some members had, you were going to work through those. So here's what I offer, that members, if you would, that Senator Dibble is now here, that we pass this with the condition, when we go, by the time we get to the floor, Senator Abler and I will work on this with Senator Dibble, and you can even be part of that. We're all going to be part of that, but Senator Dibble is committed to doing that. That some of those things that just don't make sense out of this, don't make it, we take them out on the floor, which then addresses Senator Wickland's point about it's not that easy to take everything out and then put things back in. But this way, we're going forward, we just make that. Did I get that right?
Yeah, and so Senator Hoffman, you would bring it as an author's amendment, or Senator Dibble would bring it, so clearly that amendment would pass.
Correct.
Thank you.
Scott, does that make sense to you?
that makes total sense. My door is always open, and there's hardly any legislation I've ever worked on that hasn't been modified or revised or put off to a future day.
Highway 10, for example.
The entire time I've been in the legislature. That being said, I reserve the right to disagree with some of the representations that are made. I think sometimes there is a statement that things are more difficult or more expensive than they necessarily are. And I just want to say, Mr. Chair, for the record, none of these things come out of the clear blue sky. None of these things haven't been raised and discussed previously, and they come out of the direct experience of people who are living in these long-term care settings, whether it's skilled nursing or assisted living. And so what I would ask everyone as we have these conversations going forward is to bring your best selves to the conversation, and remember, we are the stewards of the public's interest.
Senator Utke, to that point.
Thank you, Mr. Chair. And as you were explaining just before we went to Senator Dibble, what was your plan for this? That leave it in the A5 at this time, and then we would continue this conversation, and you'll be bringing an amendment to the floor that would include everything that we get agreement on, right?
Correct.
Okay.
So that the question was, either that amendment will come from Senator Dibble or myself, but Senator Abler and I, we talked about just now how that would look out, and that makes sense to me, because there's still work going on that he's having with the MDH, right? And so again, Senator Dibble, who's been putting time and effort for years in this, but if there's some things that are still really egregious or contentious there, then that would be coming in an amendment, because that's our promise.
Okay, yeah, because, even Senator Dibble had just admitted that, the parties haven't come together, so we need that to happen, and then we'll have it happen around here. And then we talked about some various things in here, and the parts that I was removing of why is it removed, and we're thinking it's already included elsewhere. So we could get clarity on all of those pieces so that we aren't adding extra layers to the definition of arbitration if it's in there 3 times already. And so, okay, with that agreement, Mr. Chair, I would withdraw the A16.
Senator Utke withdraws the A16. Thank you, Senator Dibble, again, for your years of work on this. And this is the conversations we have up here. I appreciate everybody working on that.
Thank you, Mr. Chair. Thank you, Senator
Mr. Chair.
Thank you, Senator Gruenhagen.
Yeah, I would whatever comes out of this discussion, I would like to hear from both sides.
Yeah.
and that there is true peace in the valley. Because the last thing my nursing homes need is additional complication and cost, okay? They're on the verge of not being open anymore. And you add the governor's recommendations in his budget, taking millions of dollars that he wants to take away from them.
And the houses, don't forget the other bodies. If you, ours is not going to do that, but.
No,
you
I know. But 2 out of 3 we're talking about. You know, I have to say this. It reminds me of Milton Friedman's comment that if you put the federal government in charge of the Sahara Desert, in 5 years you have a shortage of sand. We can pass all the laws we want, but one day there might be not have a nursing home because they'll be closed because they can't exist under the current laws and regulations. Thank you.
Thank you, senators. So with that, the A16 is withdrawn. Thank you, everybody. I got next, it looks like, we got the A10. You want to do that, Jordan, or do you want me to go down to?
Mr. Chair, I can move the
Thanks, Scott.
A13.
You want to do the A13?
Yes.
All right, folks, you want to hand that out? A13.
And Mr. Chair, happy to explain the amendment.
Sean Burke, you want to come up to the table on the A13?
So, Mr. Chair, this amendment takes out the blanket prohibition for home and community-based services providers, assisted living facilities, and nursing homes from requiring a resident to have or acquire a guardian or conservator to reside and receive services in the facility. It also removes the prohibition for assisted living facilities terminating contracts based off payment sources. And I think, Mr. Chair, this is, again, some language that I think just needs some more work and conversations with providers. These are blanket prohibitions on disability and aging services providers. I think is too broad and doesn't take into account the unique situations that they might face. And again, I think this is something that could have some merit. It just needs some more work with the stakeholders to get the language right before moving it out of committee today.
Members, questions? Senator Mayquay?
Thank you, Mr. Chair. I'm just working my way through.
Wasn't the OLA report just released today, too? Wasn't there, Senator Rasmussen, do you know, that raised this troubling issue regarding guardianship in Minnesota? I think that there's agreement we need to fix the system, but I think I don't know. I thought there was an OLA report that was just released today on guardianship. Senator Mayquay.
Thank you, Mr. Chair. One of the things I was really glad to not see in Senator Uckey's previous amendment is here, which is taking out a facility must not terminate an assisted living contract on the ground that the resident changes from private funds to public funds, which means that as soon as, we're looking on 40.19, which means as soon as somebody changes over from using private funds to public funds, they can be terminated. I can't. I don't think we should take that out. I think we should leave it in. And we did have a conversation earlier about requiring a guardian or conservator. That is not an assisted living facility determination. That is a court determination along with other people, but your assisted living facility, who could be owned by private equity, right? Is like just not the folks I look to be like, be part of this decision with me in order to be admitted.
Senator Rasmussen to your, and then Senator Abler after you. Senator Rasmussen.
Thank you, Mr. Chair. And I just, and again, I firmly believe that too many people are put into guardianships and conservatorships unnecessarily. And I think that there's a lot of education that needs to be done with all the stakeholders that are involved. But Mr. Chair, it wouldn't be hard to imagine a situation where a provider might believe that in order to serve that individual well, that they would need to have a guardian or a conservator play a role. And so again, it's not that this broad policy stroke is necessarily bad, but it's just we haven't worked out how it's going to go into each unique circumstance. And to the point that Senator McQuaid has on the payment source, one of the challenges, one of the unique facets of assisted living facilities, Mr. Chair, is that there isn't rate equalization.
Correct.
There is a rate equalization. And so what you could end up having is you could have individuals, if they're in a facility and using private pay, that exceeds the reimbursement of elderly waiver.
2 beds, yeah.
That exceeds elderly waiver, you could basically be committing the assisted living provider to providing services below cost for forever if they go on to a public program. And again, this committee worked hard on a bipartisan basis to increase funding for elderly waiver, to allow more facilities and more people to get into the assisted living that they wanted to. But again, this is just one of these things that isn't going to work for everyone. If you have a facility that is higher cost, private pay focused, and someone moves to a public program that is below the cost of that facility, it could create financial hardship for those facilities, and it could take options away from Minnesotans that they currently have today.
Wow. That was the conversation equalization. Senator McQuaid, do you want to follow up on that? I don't like 40.19 being stricken out, Senator Rasmussen. I still, and I understand your point, because that's also an old debate. Should we go equalization or not equalization? And when you were first elected, you said that, and then you said, nope, not going to do that. So Senator McQuaid.
Oh, thank you, Mr. Chair. I just agree. I think it's something that I don't think we want to take out.
Nope, no, I'm with you on that. So do you want to move to, I mean, is it something you would, if Senator McQuaid said, subdivision 5A, keep that in there, Senator Rasmussen, would you be okay with that, amending that to protect that, or is this something that?
Hold on, let me look at the rest of it. Mr. Chair, to Senator Rasmussen, I believe the rest of the amendment is just taking out the requirement that there's not a requirement for a guardian or conservator as a condition to admission. I believe it's in just 3 places. And I mean, I just think all of that should stay in, just candidly. I do think that the impermissible grounds for termination piece is above and away the most thing I want to keep in, but I think we should leave it all in. So I guess I just don't like your amendment, Senator Rasmussen.
Okay. Sean Burke, do you want to comment on that? Can I pick your brain for a little second?
Chair Hoffman, members of the committee, Sean Burke again on behalf of Elder Justice Center and several other consumer groups. Just a reminder, this comes from Senator Mann's bill, and also Representative Moeller's carrying this in the House, and it was really constituent driven. Our organizations have heard from many, many families who are in situations where they're either stuck in the hospital in some ways because the long-term care facility is saying go get a guardian. In those situations, we also hear from families who are forced to spend down their life savings, and then there's no room for them to stay in their home. So just wanted to remind the committee that these are constituent-driven concerns.
Yeah, and thank you, because did Bet Zerwas, was there any conversation you had with the hospitals too regarding this? The same kind of bleeds, rolls into that same conversation. Am I on the same? Was there a task force?
Chair Hoffman, members, I do not want to speak for any individual hospital or the hospital association.
No. Where's the conversation? Did you guys have conversations with them? That's what I should say.
I'll just speak on behalf of the Elder Justice Center. We actually field a lot of calls on a regular basis from hospital social workers who frankly are frustrated as they are trying to find placement for patients, and they ask us what is the legality of a long-term care setting saying, go get a guardian.
Yeah.
And we speak with them about that. And so we do think clarity in the law would be very important in this instance. And it is a tricky issue, but we would agree with Senator McQuaid around the idea that it's really not a provider's call on whether or not a guardian is necessary.
Okay.
So this is good language from our perspective.
Final thoughts before Senator Abler?
Well, thanks, and I agree with the guardian thing that was just talked about by the elder justice people. I don't know why that this doesn't make sense. The math question is a question, but Senator Hoffman, I've been frustrated by this There was a place in the city of Ramsey, a very nice place. I won't burden the world with their name, but somebody I knew lived there and enjoyed it. And in the contract they signed, they said, well, you can keep staying here in the fine print, subject to availability. And they had 2 elderly waiver beds.
Yes.
They took all her money and then kicked her out. So this language is much stronger than that. I think could be worked over, but there should be at least a clear disclosure what's going to happen. And so I think it could be worked on. But I think that for today, I would not support the amendment with my good friend. Thank you.
Well, this is why we exist. So any final thoughts there in your amendment? You want to go to vote, or what do you want to do?
I'd say, Mr. Chair, again, would ask, if this is going to go, to the floor, would we have your same commitment on this items as we did in Senator Dibble's bill?
Always. Sean Burke, you want to help us get a win-win? Yeah. He's like, yeah.
And
Senator Abler, I think we could,
Because again, Mr. Chair, here's the issue is when we have additional regulations that are being, driven by groups that are kind of trying to identify problems. The Elder Justice Center isn't thinking comprehensively about the regulatory situation for assisted living.
Okay.
They get constituent complaints, they develop policy for that, and they bring it here to this committee. And I just worry that if we do this session after session, we make it harder and harder for providers to provide, then we shouldn't be surprised when we don't have those providers anymore. Or, Mr. Chair, we shouldn't be surprised when we have one of the highest cost provider systems in the country because of all the regulations we're piling on. And again, I think this could be a part of a more thoughtful conversation than just kind of adding on more and more every single session.
Best place to have it. So thank you, Senator Abler. Final thoughts on that?
Well, thanks and to the elder justice folks and Senator Dibble, who's not here anymore. Just a bit, if people want to get something done on this topic.
He's still here.
Oh, you are? Okay. I thought you left. I'm sorry.
Jim, don't you remember Highway 10 and the Armstrong Bridge?
Oh, yeah, thanks. Thanks for the money. I just want to encourage them as going forward that the other body is going to be much less interested in a lot of this stuff. And so the more it can be worked out, the better, so that some good things can happen. And so just...
So if I can get Sean and you guys,
thanks.
please, will you find Rasmussen after this? And I mean, and I'm just not pointing on you, Sean Burke, but you happen to be the only one in the room I recognize. Since Matt Freeman left, I can't point at him anymore. So, yeah, you have my commitment on that one. Absolutely. And this is all we do is have that. So, yes.
Mr. Chair, with that, I'll withdraw the A13.
The A13 is withdrawn. Good conversation. We got, Jim, you want to do min choices or waiver reimagine? The A17.
A17.
Does anybody got an A19 so we can do that song? Go ahead.
I could change mine today. I could amend my amendment to be the A19.
Oh, you could. Senator Abler, talk about your A17.
Okay, so here's, I don't know if we need to just talk very long about it. We enjoyed your hearing about the Waiver Reimagine Task Force. What this does is a couple of things, and if I forget something, Mr. Monahan can fill it in, but this actually adds some teeth to the collaboration that I spent 2 or 3 days debating with then Commissioner Harpstead about how we're going to get this to work together and so on. And so this actually just simply makes this a truly collaborative body. And so I took the heart of Senator Hoffman's task force, which I just see as impractical, respectfully. There's no money to fund a task force anyway. But to take this existing group, add some members to it, and then require the department to collaborate. Collaboration, we mean it, in a way when it comes to redesigning these things to the point of getting the approval of this group for things going forward. It needs some work. It's you can tell it's still kind of, the ink isn't dry yet. I want to commend Mr. Monahan for taking a very scratched up draft and making it into something worthwhile. A lot of it is really sound. I'm happy to work with everybody, the department and the stakeholders and everybody, but I think I think this actually will get us to where we want. I wish we would have thought of this 2 years ago. And so one thing that I need people, the timelines are kind of not quite right, and Mr. Monahan, that's my fault. And so just when the report's due and how long they have to do it, the timing, we'll figure that out. And who should get to be informed. On line 5.31, it says we should tell all the waiver recipients, which could be an email. I think the 6-month timeline on page 6.1 is a little long. Like I said, I don't want to blow it up, but it has to work. And I think given how some of these things are rolled out, it just has to work. And I know that the interest of the department is very strong to have this work out. And then finally, on the waiver reimagine, you do the full meal deal and then 2 little ones. On line 6.5, it just says take that out of existing resources. And again, that's not any affront to anybody, but I'm very concerned, Mr. Chair, and I'll work with everybody on that too, but at least that makes sure that element is fiscally neutral for the time being. And I don't want to deprive the department of money they need, but I do want to deprive this place of the ability to not get this done. And it will be nobody's fault for any positive efforts or negative efforts, but we have to get this done. The counties are drowning. Senator Gruenhagen said again that we're months behind. Ramsey County hired 80 people with money they don't have. And so if you can go with the full meal deal and 2 small meals, but it also is very clear in the bill, which is already there, that people can opt in for everything all the time if they want. And so it's truly consumer choice. And I like where this is going to go, and advice people have from the audience and everywhere, I'm happy to take. So that's the bill.
The last hearing you had as the chair of this committee, that conversation, waiver reimagine, and I'll never forget that. And the parents wanted to be heard, listened to, and valued. Remember that?
Yeah.
And so we also have some financial provisions in our budget bill that we're going to try to buy back, or whatever you call that, right? But I love this because of the fact, if the finance piece doesn't work, you've now put an accountability piece on there so thank you for bringing this.
Well, thanks. And just one thing else, we don't pay anybody to come, but I knew all those parents would be happy to involve them because we don't have any money. But I believe, Mr. Mohamed, is this day that Zoom is going to be offered for these meetings? If it doesn't, we just need to add that.
Mr. Monahan.
Mr. Chair, Senator Abler, I believe the Waiver Reimagine Advisory Committee is conducted only via Zoom.
Oh, well then there you go.
There may be an in-person option, but
Okay, well, I'm happy with, thank you very much. And so I don't want to burden anybody, but many of the people on here are already getting paid. But I think that, well, Ms. Ware and others, I think they would happily turn their Zoom to have an hour-long meeting. And clearly they're involved and they're totally invested anyway. So anyway, looking for people's advice. So I think with that, Mr. Chair, take questions or we'll just vote.
Members, questions for the senator from Anoka? Everybody giving thumbs up? Glenn, you want to?
Yeah, well, thanks for bringing that, because we had a lot of controversy on the waiver reimagine. There was talk about delaying implementation. Does this address that in any way?
No,
Again,
no, it does
Aaron,
not.
or say that?
No, about delaying this has no, this just says the plan has to be approved going forward.
That's it, yeah. And DHS is saying there's a cost, but you know what? I'm thinking, Senator Abler, you're not incurring a new cost in here. You're just saying this is existing, correct? Yeah. So the answer is no, it doesn't have any new costs. So I will be more than happy to add this into the other bill as well, Senator Abler. So
Aye.
everything has a cost. This one doesn't have a cost. Using existing resources to implement the change in the process developing, they already have this plan, right? And they already have this piece, right?
Mr. Chair, the task force is, the advisory whatever thing is already functioning. This just gives them more authority to work with it. It's
I'm good.
Collaboration, we mean it, Mr. Chair.
If it's collaboration, we mean it. So members, anybody else? We're good? Everybody shaking their head. All those in favor of the A17, admit by saying aye. Aye. Opposed, same sign. Thank you. The A17 is adopted. That was your waiver reimagine one. Do you want to do min choices too or not?
That's already in there, I think.
It was already in there? All right.
Is there something else I have?
Yeah, I thought I had two. Admin choices, assessment changes, and the waiver reimagine.
Oh, I have to do a technical, yeah.
You got to do a technical thingy.
Okay,
All right.
yeah.
Mr. Chair?
How many do I have? I have 6?
We were with Senator Gruenhagen.
I got the 812.
Jim, Senator Gruenhagen's got the 812. People want to look at the 812? I still can't do my Steely Dan song.
I have an A6.
And Jim's got an A6 when the time comes, Glenn, so that's good. How come I knew that? Senator Gruenhagen, you got the A12. Can somebody have an A19 for us so we can sing that song? Yeah. Oh, it's Hey 19, forget it. I only get to do this once a year. Yeah, I'm just getting my head shaking it. Glenn, talk to us about your A12.
Okay, it.
Fire away.
Thank you, Mr. Chair. Yeah, it moves to delete page 36, delete section 22. And what does 22 address? The amendment strikes the requirement for any existing or new assisted living facility to put in a 2-hour firewall between them and any of their neighbors. This is an unfunded mandate on our nursing homes that would require them to reconstruct their facilities based on who their neighbors might be. We should be focusing on ensuring that our growing aging population state has a place to live and receive care as they age. Mandates like these only make life harder on the providers who are doing their best to provide high-quality care for the residents. So it's another unfunded mandate at a time where they're struggling to make ends meet. If you want to pay for it, I'd probably be open to it, but if you don't, I just don't think it's necessary at this time. So,
Senator Rasmussen, thank you, Senator Gruenhagen. I love this amendment. Senator Rasmussen.
Thank you, Mr. Chair. I concur. I think this is a really good amendment, and I think it's especially important for smaller providers and also for providers in rural areas where, for example, in the area that I represent, you'll have a lot of facilities that will have both independent living and assisted living in the same facility. You can also see other types of services provided in the same setting. And again, those are meeting all the requirements today. And so I don't see a reason to add in this additional barrier just because there are different license types, or you might have a licensed setting being in the same space as an unlicensed setting. And so again, this will add another unfunded mandate onto our providers that they don't need right now.
Imagine that. This committee's getting rid of unfunded mandates. I think that it should be the Senator McQuaid and then Senator Gruenhagen.
Thank you, Mr. Chair. I see that folks have.
Did you just hear that? The keyed up. That's the 8th.
Oh, sorry.
And who says we don't have fun? Aren't you glad you joined this committee, Glenn?
I'm beginning to.
Senator McQuaid.
Thank you, Mr. Chair. I think this feels really specific. I feel like there might be a reason for this, and I feel like maybe the department wants to
I
say
feel that
something
would be
about
good.
it.
Is somebody at the department, especially if you're a fire extinguisher kind of expert, so talk to us.
Sure. Yes, Senator Hoffman and committee members. Again, my name is Daphne Pons. I'm the State Executive Operations Manager for the Assisted Living Program, also over engineering department that has essentially brought forward this proposal. And I can speak to the concern that was brought forward about nursing homes. This actually already exists for our current nursing homes. They have this 2-hour barrier already constructed. According to NFPA 101 standards, it is a protection that creates a barrier between, it's a barrier that already exists between nursing homes and attached assisted living facilities. Right now, the 144G.10 says that the license attaches to the entire building, that you must manage, control, and maintain the entire building as an assisted living. That would include by construction standards, covering also the nursing homes. And so we don't have a clear licensing and construction path that are congruent, and this just helps provide some boundaries. We have basically an engineering solution to a licensing issue to say, where does the assisted living license begin and end? This also would open up the areas for, right now we say that the entire building has to be maintained as an assisted living. If a provider wanted to put a different type of licensing type or have independent apartments, this would provide a solution to where we could protect the assisted living residents for emergency response, have that 2 hour, at least that 2 hour barrier or greater, and then another unlicensed entity such as senior housing that wouldn't be in the assisted living license, adult foster, other types of licenses could be on the other side of that barrier while providing the protection for the assisted living residents. And that's really the intent, because currently the statute doesn't have a clear code path for architects and providers that would like to build assisted living facilities where they can provide a plethora of services, maybe in by construction code, the same building, but the license, the way it's currently worded, covers the entire building, which is kind of an unexpected outcome of what was passed in 2019.
Senator Wickland.
Well, that sounds like a good reason to not take this amendment. I think that that's pretty clear that it is being thoughtfully designed to help facilities, be clear about what they can and can't do in terms of adding an unlicensed facility type. So I would be opposed to the amendment.
Okay, Senator Radke. Thank you, Senator Wickland.
Thank you, Mr. Chair. And actually, I'll just give a little different slant to this whole thing. I support this amendment because the last place I would go to look for a fire code instruction is in statute when you're doing a building. You're going to go to your building inspector, because I've had to do that in the building that I own.
Sure.
And when you're doing the construction, that's where you're going to get those type of instructions about what you need to do for your walls. So I see this as already being in fire code. Our building inspectors, they're all going to have that, and it'll be in place. To me, this is duplicative and not needed.
Thank you, Senator Radke. Senator Abler, then Senator Gruenhagen. Senator McQuaid, did you want to respond to that? You want to go free? I bumped over because you guys were done. She asked the question. I violated the covenants of this committee. Senator McQuaid.
Thank you, Mr. Chair. Contrary to Senator Radke's point, I actually think that the confusion exists and henceforth the clarification. And I really wouldn't feel comfortable taking it out. When you read something without context, it can seem very random, but then you get the context, you're like, I see, that's very important. So I would just want to leave it in.
I got you, Senator Abler and Senator Gruenhagen.
Well, I think it actually might save money for some people, because otherwise, I was unaware of this till I heard the discussion. If you don't have this firewall, then you're in charge of the whole building. Let's say you build an assisted living in a mall or something. You wouldn't put this, whatever, at least you're in charge of the whole thing.
Right.
Now you're in charge of your place, but 2 hours up and you're done. You can do whatever you want next door. So, I don't know, I appreciate the departments. This was in the original bill, I think, right?
Yeah.
Yeah. I don't want to add more duties, but clarification might help, so maybe people understand.
And I have some thoughts, and I need a local one too. Senator Gruenhagen, and then we'll...
Oh, thank you, Mr. Chair. Yeah, I just have a question for the testifier.
Yeah.
So would this increase cost in the construction or existing facilities that we have in the state?
Ms. Pons, right?
Yes. Chair Hoffman, Senator, essentially for new construction or new buildings. Right now, like I said, in nursing homes and attached assisted livings, this currently exists, so there wouldn't need to be anything new built. It would be a cost if, of course, construction costs, if an existing building wanted to build at least a 2-hour fire barrier. There would be a cost if they wanted to separate out, but it would then give them that option, if they wanted that expense, to be able to provide a different service within their building. For new buildings right now, it is a cost for a 2-hour barrier, but we have architects that are seeking guidance as to how that they can help providers have a variety of services in their buildings. And if they're building just as one building, the way the license currently attaches, there's no guidance in the statute or in the code to actually separate that out from a licensing perspective. So there is cost to construction, but it does give a clear path for architects to follow, for providers to follow when planning their buildings, and that's what's created. We've been living into this for 3.5 years now, and there are a plethora of questions. This comes in on plan review, despite any fire code or local or anything of that nature with architectural firms or Minnesota Fire Code, which we are required to follow as well. This could be not denied on plan review if these specifications aren't put in place. We don't have a pathway for providers to do what they would like to do in a building if it's looked at in construction terms. And so providing clarification in the statute actually helps providers.
So thank you. Members, we're going to go. We got to move on, Glenn. We got another one because I like this amendment. Where I live, there was an small assisted living provider who had a duplex. And she happens to be the daughter to the ambassador of Dubai, right? The Liberian ambassador of Dubai is from Minnesota, from Brooklyn Park. And she got no concessions, no direct access. It took forever. I got a plethora of emails, and folks at DHS know I was sending, what are you going to do? What are you going to do? What are you going to do? She shut it down because of that. Because of the fact they said you don't have this 2-hour wall between these two, which is an existing place. So I like this amendment. I think there still needs to be a lot of work done on this stuff. And that's just not the only one that happened to, right? So I disagree with this, I hear what everybody's saying in here. I like this amendment. And so I think it should go on to our stuff. And that's all I'm saying to you guys, so.
Okay. Well, I'm just trying to bring the love to the
I love it. No, you're good. Did you want to say anything before Rasmussen says the final words?
Well, I think her response was yes. So just short, between all the words, it was yes, the costs are going to go up.
All right. Senator Wickland, go ahead, and then let's pull the A12.
Mr. Chair, I would say her response is that due to the lack of clarity, that there can be confusion and it can take builders and architects more time to figure out how to build. And so that is going to add a cost, and it could be at the detriment of facilities being constructed. So I would interpret her response differently, and I think this particular section should stay in.
Thank you. So, let's go. We're going to vote. All those in favor of the A12 amendment, signify by saying aye. Aye. Opposed, same sign? No. Whoa. It's even. I had a division here. All those who like the amendment, raise your hand. 4. All those who don't like the amendment. This is our committee. It does not pass. Thank you, guys. It was 4-4.
Yeah, 4-4.
Yeah.
Vote against me.
I can do my math. Some people can't do math is mathing. That was good. All right. I got math to mathing. That was a good conversation. So A6, Senator Abler, A6, pass it out. How many guys got left? Abler's got one. Gruenhagen, you got? No, you already did yours. You did yours. No, Utke, I don't have any more. Do you have any more? He's got 4 more. Utke's got 4 more. Who wants to take him outside right now? We're going to have a chat. I think Jordan's got one and Jim's got one. That's it. The A6.
So, Mr. Chair, I'd like to move the A6, and I'd like to ask Mr. Monahan to please explain it.
Mr. Monahan, please explain.
Mr. Chair, members, let me get myself situated here. So this language, or this amendment would delete the current version of Senate File 2598 that's in the bill that has to do with reassessments, and insert in its place language that was represented to me as technical assistance from the department, and then would add Section 23 to the end of the bill, instructing the commissioner to implement the changes related to reassessments within existing resources.
Senator Abler.
Thank you, and I just want to make sure that, you know, JP, this is what we want, right? This is to the counties, this is all worked out. This comes from the House, I think, in particular, the Department of the House.
Did you say the House? You're in the Senate. You're supposed to say other body, aren't you?
So can the counties just look at me and tell me this is the right one? Are we...
Ladies and gentlemen, now approaching the stage, Matt Freeman.
So this has been really a work...
And JP.
A work on the counties and others that have really been working toward this, and I'm confident we're not doing any harm to it, but I just want to make
This
sure
is good. This is a good conversation. Did you know, the thing that, no, I'll go ahead. I want to hear what Matt has to say because it'd be like,
I don't want
did you, you don't want to? Okay.
Mr. Chair, members of the committee, Matt Freeman from the Association of Minnesota Counties and MAXA, the Social Service Administrators. The technical assistance, I believe this is technical assistance provided from DHS, plus there are two pieces that were additions that were a part of a work group jointly between DHS and counties that are included in the technical assistance paragraph that are implemented. And then I believe the section 23 is not a part of that technical assistance. But am I looking for?
No one's going to help you in the back corner there, Matt. I don't know why you're even looking. Unless, I think this is a great conversation. You're still going to have to get federal approval on this, right? Because the feds say it must be fully assessed, right? But you're doing the attestation. Does anybody want to come and help provide guidance, or am I just going to say, pass this and we're moving along? There we go.
It's good.
It's good. You coming up, JP's, you're good. All right. No, it sounds like people have been working on it. I really appreciate you. This is lengthy conversation for years, and I appreciate this.
And so, Mr. Chair, I appreciate the collaboration. I imagine there'll be some more discussions, but if the discussions can go toward more flexibility and more consumer choice, we need that so the counties can indeed serve people. There's just not enough humans to do all this. So I'm ready to vote.
The verbal attestation. All those in favor of the A6 amendment indicate by saying aye. Aye. Opposed, same sign. Thank you. Mr. Freeman, good to see you. Senator Abler, we got, I think I have.
I'm done.
You're done.
I'm done, right, Liam?
You're done. Hutke's done. Jordan, there's an A10. Is that you, Jordan?
Yeah, Mr. Chair, I'm not going to move the A10, but I'd ask that I ask the page is distributed. I just want to talk to it for a second.
You want to talk about it?
Yeah. So, Mr. Chair, this is a provision dealing with health insurance, and again, it's, I think, still waiting to be heard in Commerce. And so I just wanted to flag that for you, as this bill's going out, that, just want to make sure you don't have a Rule 21 issue on the floor with this bill. So,
Senator Rasmussen, it is my understanding that's been waived. They waived it, so we're good. So whatever direction we need to go, it's committed to our committee. So you guys.
Thank you. And so, Senator Rasmussen, Mr. Chair, Senator Rasmussen, I am happy to engage with the interested parties. Just so you know, Mr. Chair, as of this moment, the health plans have not come to talk to me about this, and I would be happy to have that conversation. So to any rookie wannabes running for office, the best way to get attention to a project is to have a bill that's moving in. So I bet they will be calling me. Thanks.
This is going to be our number. 15 years ago, he did that. Bye. Thank you. Yeah, you're good. You're going to your thing. Thank you so much for staying with us. Senator Rasmussen, any other comments you and May Quaid want to make on this? No? I'm glad. So that's done. Members, any other amendments? Utke said he had 4. He was only joking, though. I think we're good. Good conversation. So, no more amendments. Is there any other business on this that I need to attain to other than a verbal attestation? So, Senator Utke, do you want to make a recommendation that 2443 be recommended to pass as amended and be put on general orders?
Mr. Chair.
Mr. Senator Abler.
Mr. Chair.
I think you want to amend that to just include staff can fix it up however they like.
I got that.
Okay.
You know what? Thank you. Will you add that? Senator Utke moves that Senate File 2443 be recommended to pass and put on general orders, and that staff be allowed to
Make it tight.
make technical changes and
All that.
updates as needed.
All that.
Senator Rasmussen?
Thank you, Mr. Chair, and I just wanted to, before we vote, just offer some comments on it. I do appreciate the work that's been done in this committee and the work that's gone to this bill. I do still think, Mr. Chair, that the bill before the committee still needs some work. And we talked about that with Senator Dibble's bill and others. And I just think, you know, my hope is that work will continue so that we can have more support for the bill on the floor. But I'm committed, Mr. Chair, to working with you and anyone else to get the bill cleaned up so it's ready.
Thank you. And I take that as your commitment to work with Mr. Burke, Ms. Scheller, and the folks to get it done. Senator Abler's, Utke's in there. Senator Greenhagen, any final comments?
Yeah, just thank you, Mr. Chair, just real briefly. I just think there's still too many provisions in here that are going to drive up the cost from assisted living and nursing home. Okay, so I'm going to vote no today, but I hopefully can work to address some of that, especially the Dibble provisions in there. I have a lot of concern about, and so do the people that represent those areas.
Yeah, and thank you, Senator Greenhagen. This should not be any finance in there, but I appreciate your comments on that. So all those in favor of the Senator Utke's recommendation, I'll oppose the saying aye.
Aye.
Aye. Opposed, same sign?
No.
It passes. There we go. Thank you. Get to work. Thank you, everybody, for all your work on this. I absolutely love this committee. I appreciate everybody's work on here. So thank you for working together, even though we disagree and we agree. So with that, we are adjourned.